Hey guys, it's Joseph. Welcome to Young Money Talk. Today's Mind Body interview is particularly special because we have two women, Rita and Tamara, who overcame chronic regional pain syndrome, or CRPS. It's one of the most, if not the most, severe forms of TMS and mind body illness, and they share all about the nuances of their journey and their recovery. Now, when most people bring these two on the show, they give them about 30 minutes each to make an hour long show. However, I thought that they both had enough to share to give them over an hour each to talk about the nuances of their recovery. I think this is important because we have a lot of information about the mind-body connection and how it works. But the main question that everybody always asks is, what do I do? I see the mind-body connection. I even think it applies to me. But now what do I do? And what to do? That's the meat and potatoes of recovery. And so while you watch this, I'm not saying that you should copy exactly what they did because you shouldn't. Everybody's recovery is different. But when they talk about the intricacies of their daily lives and recovery, I hope that it gives you more insight in your own life and in your own journey if you're watching this and you have TMS. So, for those of you who are going to watch through this whole thing, you will be intrigued, you will learn something, and I'm hoping you get lots of value from it. I'll see you guys after their interviews. Hi, everybody. Welcome to Young Money Talk. This is the second interview of a Mind Body series where we'll have people sharing their stories. I'm so excited to have Tamara on right now. So Tamara overcame CRPS, and she also wrote a book about her experience called Defying the Odds. It's on Amazon. I'll put the link in the description for anybody who's interested. I've personally read it. I really like it because it goes into the nuances of recovery, and we're going to talk about some of those nuances today. So thank you so much, Tamara, for coming on. How are you?
I'm fine, thank you. Good morning. And just one small correction. The book is called Define the Verdict. So I'm going to...
My bad.
Yeah.
There you go. Okay.
Yeah.
Define the Verdict. Yes.
Yes.
It's a great book. Go ahead and check it out, guys. But Tamara, thank you. I want to ask you a few things about things in the book. But first, before we get into anything, can you briefly share your story?
Yes. So my CRPS experience started in September of 2015. As a matter of fact, I remember to a day when I woke up one morning and my left arm was swollen and was very painful. There was nothing special about the day before. It just happened overnight. And I went to the doctor. I was diagnosed with carpal tunnel syndrome. I did whatever the doctor prescribed, which is wear the brace, don't overwork your hand. I thought it would go on for a couple of weeks and I will be back to normal. Well, it did not. It actually kept getting worse and worse. And within about 2 to 3 months, since the beginning of this problem, I became almost completely incapacitated as far as my arms go. I lost ability to write because both of my hands became affected. I had severe neuropathic pain that kept me awake all the time. Over-the-counter painkillers pretty much were useless in that situation. And then the worst part, all of a sudden, my hands curled in and I lost dexterity in my hands. I lost ability to grab things. I had to use grip gloves if I wanted to open doorknobs. Those round doorknobs became a huge obstacle for me. I developed sensitivity to touch and temperature. So in a 70-degree weather, I had to wear gloves because my hands would respond with huge explosions of pain if I touched anything cold. So then it became pretty obvious that I had Raynaud syndrome, the condition where all of a sudden your hands turned blue, wide blue, and then severe pain kind of shoots through the pants. So that continued on for about 5 to 6 months when I finally discovered Dr. Sarno, and that changed my life. All this time, my doctors insisted that what I had was carpal tunnel syndrome, but my symptoms did not add up. I kept searching, searching, searching. Finally, it became apparent to me that what I had was complex regional pain syndrome, which I don't know if you wanted me to go into the details of it. It is considered a rare condition.
Yeah,
Um,
go into the details.
yes, and so CRPS previously was known as RC, reflex sympathetic dystrophy, which by itself is a scary name. And it is sometimes called suicide disease because the pain is so severe. People actually beg their doctors to amputate their limbs because pain is so intense.
And
Uh,
some doctors do it, right?
and some doctors definitely do.
Yeah.
And I heard, but this to be confirmed, I never found any confirmation to this, and wasn't able to validate. But I was told that the standard procedure in VA, Veterans Administration hospitals, for the veterans who experience CRPS, which I'm not surprised they do because they
Right.
they they have to operate in extreme conditions. And so PTSD is a norm rather than exceptions among the veterans. The standard procedure at VA is to amputate the limbs in response to CRPS. So this to be verified, but this is what I heard. So this is absolutely terrible. What happens as a result of this, the limb goes away, but the pain stays. It is called phantom limb pain.
Phantom limb pain, right? Yeah.
Yes, which is also very well known to the military veterans who had their limbs amputated. So then they go through some special treatment. There is some magician doctor in San Diego who helps them. And what he does really is psychological treatment
Right.
for the pain that now obviously is in the brain. And so the the pain for chronic pain conditions is usually measured on scale 1 to 10. For CRPS, pain is measured on a different scale, and so they estimate that the pain from CRPS approximately equal to the pain during amputation without any anesthetics. So, or childbirth. And imagine a woman spends several hours in childbirth. CRPS pain is with you 24/7 all your life. And so, once you get a diagnosis of CRPS, the treatments that are offered to you are almost as barbaric as amputation. For example, there is something called denervation, which means that they kill the nerve that goes into the painful spot, which means that basically your body is deprived of the key function. Then there are all kinds of nerve blockages, Botox. There is something called ketamine, which is off-label use of ketamine, which is otherwise used for other things. Because of that, ketamine shots are not covered by insurance, and a single shot can cost $5,000 to $6,000. That's what I've heard. And in addition to that, it only works for several months and comes with severe side effects. Um, and then,
So
yeah,
with the nerve block, because I did some research on CRPS before. Well, actually, some doctors have told me that that's what I have. I know it's all TMS, so I don't get too much into the labels, and I know there's no good treatments anyway. But for the nerve block, isn't it actually the sympathetic nerve block, right? That's
right.
what they go. Isn't this if I'm not confused, the sympathetic nerves or nervous system, that's the fight or flight nervous system, right?
Exactly.
So they,
Yeah.
yeah, so they try and block the fight or flight nervous system to heal. That should be a clear indicator that something is TMS. Do you have any comments on that?
Yes, I think it's a very astute observation. I think you're absolutely right. I actually write it in my book. I was lucky because before CRPS happened to me, I read a book by Stanford University professor Robert Sapolsky, and I actually quote his book in my book. It is called, the book is called Why Zebras Do Not Have Ulcers. And he goes into very deep discussion on why people, when they are in a stressful condition, why do they wet and soil their pants? Why people throw up when they're in a state of great distress? It's very simple. Once you are in a fear for your life, your sympathetic nervous system immediately goes into that fight or flight mode, which means that it has to release your everything that prevents you from maximizing your response, which means that it empties your stomach, it empties all the unnecessary liquid so you can run faster and you can fight stronger. So this is so when I started putting the pieces together, I realized that that book was very helpful to me because it explained the mechanics of how brain
Right.
operates, how sympathetic nervous system that permeates everything in your body, that drives every little function. Once your brain is put in that fight or flight mode, it starts either shutting down the functions that it believes it doesn't need, or it starts sending signals of pain, because pain is what puts us in that action mode. When we need
Right.
to run, when we need to fight, that's
Right.
what happens. So at that point, brain is in state of panic, and it fires all the signals. Sometimes it appears to be randomly, but based on its own logic. And that's how you get chronic pain condition. That's why people who have a broken bone, it takes about 6 weeks for a broken bone to heal, and then the pain stays. Very common condition, very common reason for CRPS to develop is some kind of an injury. Injury healed. There is nothing wrong with the body in that particular part. Your hand is healed, your leg is healed, everything should be okay, but pain stays. Not
Right.
only it stays, your body starts swelling. It changes skin color. All kinds of absolutely outrageous things happen. And it's all because your brain and your sympathetic nervous system are in that spiral, downward spiral.
Absolutely. Yeah. Um, in good point about the injuries, because a lot of psychosomatic things, not just CRPS, start after injuries. I've had about probably 4 or 5 injuries that turned into chronic pain issues in the past, and I used to think it was because my body didn't heal as well. And I know that's not true now. Pain can be present in the absence of tissue damage or injury, as anybody who knows about this TMS stuff knows. Now, for the sympathetic nerve block, I still want to go back to that. Did you find that? Because in my research, I couldn't really tell. I did see a few cases where it worked, but in your experience, have you seen it work for most people or for some people?
You know, I don't know many CRPS patients because people who are deep in the throes of CRPS, they somehow don't like to talk to people like me who actually recovered. And now we're getting into the issue of Stockholm syndrome, which I think we should
Oh,
touch on.
yes.
But let's set it aside for now. And
Okay.
so, but I have seen complaints, and I actually have seen studies which led to my decision not to go for anything like that. That nerve blocks, the steroid injections, the Botox injections, they have pretty low success rate. And I actually write about it in my book that for every treatment that was offered to me with my carpal tunnel syndrome diagnosis, I actually dug very deep. I went to look for medical research. I went to look for clinical trials and statistical results. And I found out that really the efficiency of those treatments is very low. The success rate for example, steroid injections, which is what was offered to me with my official diagnosis, I was never offered nerve blocks, so I didn't really dug in very deeply in that.
Got it.
Was somewhere around 50%. So, you can just flip the coin and you get pretty much the same. And you can flip the coin for free while, the steroid injection, even if you have insurance, still costs you some. And
Right.
of course, side effects. After a while, they stop working. It is well
Oh,
known that steroid injections cannot continue forever. So I think they stop after 3, 4. If it doesn't work, they just do a surgery.
right. And
And that
steroids.
further damages
Right.
the
Right.
body.
Right. And the steroids don't never made sense to me. The sympathetic nerve block though, that one is the only logical treatment in my opinion, because I mean it is getting at the root of the issue, which is the nervous system. However, I actually saw it work for a few people, and probably these people would have been people where if they read the Sarno book like one time, they would have been cured. Because if you can be, what's going to happen with somebody, let's say a sympathetic nerve block does work, but if you're somebody who's an extreme TMSer and you haven't dealt with your personality and your emotions, it's just you're gonna get something else. You're gonna get or it's gonna come back worse. So, yeah, that's my thoughts on the sympathetic nerve block. But I know it doesn't work for everybody as well. And I think the reason why is because I, for some people, it's like if the body wants to tell you a message, it's gonna get it to you, and it doesn't matter what you try, it's gonna get that message to you. What do you think?
I do agree with that. So there is this very fascinating subject of placebo. And I
Oh,
started reading on placebo, and there is this very fascinating book. It is called um, Cure. It was written by a woman in UK. Her name is Jo Marchant, and she talks a lot about placebo. She's actually a microbiologist by her education, so you can't blame her for being, one of those religious cuckoos who believe in, magic touch and stuff like that. And so she really digs very deep into mechanism of placebo. And I also knew about someone who is actually a doctor of Chinese medicine, who trained in Chinese medicine in China, who then was invited by Harvard to teach Chinese medicine to their students. And then he got really interested in the phenomenon of placebo, and he does some absolutely mind-bending experiments with placebo. In my opinion, the nerve block could be a placebo,
of
but
course.
it can also be a shakeup to the nervous system. Because remember, they're shooting this nerve block into sympathetic nervous system, and there could be the backward, the feedback into the brain, and maybe that's a shock that puts brain out of that fight or flight mode and works that way. That's my hypothesis, but I'm not a scientist. I'm not a neuroscientist, and as I
Oh,
was
even they don't know. Even they don't know. So you're not much worse off than them. Yeah.
no, and to be honest with you, people find all these little holes in Sarno theory, right? And I keep telling them, Dr. Sarno was absolute genius because at the time when he came up with his theory, which he proved experimentally over the years, right?
Right.
Neuroscience, the way it is right now, as we know it today, did not exist. Neuroscience, as modern science, started developing in the 80s and 90s. And it
Interesting.
was, yeah, so as Dr. Sarno was putting out his books, neuroscience did not exist. So he did
Right.
not have the foundation to scientifically explain his findings. And it's only now Dr. Schubiner, Alan Gordon, all
Right.
these modern TMS researchers, they
Yes.
are the ones who are operating with the language. Oh, and by the way, uh, oh my God, what's his name? It will come back.
Where does he work?
What?
Where does he work? Maybe I can help you remember.
Mosley, Lorimer Mosley.
Lorimer Mosley, yeah.
Yes, these are the people who operate with the concepts of CMS rooted in the real modern neuroscience.
Yes.
And the modern neuroscience yet still to be developed. And now it is digging deeper. It is digging into multiple sclerosis. It is now looking at Parkinson's, and it is looking for the roots of TMS in those conditions.
How exciting.
And this
Yeah.
is where it gets really interesting.
Yeah.
I would stop right here and I would not make a next step claiming, because what do I know, that multiple sclerosis or Parkinson's are in fact TMS. But I know already that dystonia, which is also considered a motion disorder, and dystonia was one of the most profound symptoms with my CRPS because they sometimes come together, is most likely TMS.
Well, very interesting. Well, I will say this on the MS topic. I have a buddy who, when I was first learning about this TMS stuff, I would share what I was learning with him. And he was telling me about his mother who has gone through really traumatic things, severely traumatic. I mean, she's seen multiple deaths happen right in front of her eyes. She didn't handle it well. She never sought out therapy. And after, I mean, decades and decades and decades, she developed MS. And to him, this just made sense right away. And it's interesting because there's some people that they just do get it right away. Like he was like, "Oh my goodness, this is why my mom has MS." Whereas for other people, including me, when I first found this information, I just didn't accept it like that. I just couldn't see the connection, which is good now that we have the neuroscience because it proves the connection. You can't deny it; it's there. The difference, though, I think from the neuroscience and the Sarno, I wish they would start connecting more and more. I think Schubiner and Schubiner is doing that. Lorimer Mosley, I feel like his research is more just making the proof of the mind-body connection, but he doesn't get into the psychology, at least from what I've seen.
He's a neuroscientist by his background, and they are coming from different sides.
Angles, right.
From different angles. And Dr. Schubiner, because he is a clinical practitioner at the same time, because he is a primary doctor, he sees patients, he's looking at the whole patient. And he obviously brings psychology into clinical practice, while Mosley is looking at it as a neuroscientist.
Purely neuroscience, yeah. And his books are insane. Like the experiments are pretty crazy. Like he'll get people to feel pain when they're not even being touched. Like just from the perception of being touched. It's crazy.
Yeah.
And that's phantom pain right there. Not,
Exactly. Yeah, and to create a condition when without any injury, without anything, he can actually make a person feel the pain.
Right.
Amazing. And then Dr. Schubiner, in one of his talks, cites the case when a nail goes through the boot of a soldier.
Oh yeah.
And the soldier.
I've seen that one.
Yeah.
Yeah. So funny, yeah. He gets to the hospital and then there's no nail and it missed his toes. It went right in between. Yeah.
Yes.
So
and
funny.
then there are these absolutely insane experiments that, this Harvard researcher that I mentioned, Ted Kapchuk, who wrote an amazing book on Chinese medicine, by the way, he actually does some amazing things with placebo. He actually gives people placebo pills, and he tells them that this is placebo. There's no medication in this.
Don't tell me it still works.
And and there is this classic story of a woman who had absolutely severe IBS, irritable bowel syndrome.
Yeah.
For years, she could not function. She could not leave the house. She was absolutely miserable. And he gives her pills, and he says, "This is placebo, but it is known to work." Her IBS disappears. And then several years later, it comes back. She goes to him and she says, "Can I get those pills?" And he says, "Well, we finished the experiment. I really just don't have those. Please give them to me." And I don't remember where that story went. I believe he gave her the pills again, and her IBS disappeared.
Yeah. Wow. And she knew they were placebo.
And she knows
She knew.
it is a placebo. And he does all these absolutely twisted trials with placebo, this way and that way. And it is so fascinating and so mind-bending that I wish I were a neuroscientist so I could really get into that.
Yeah, wow. I mean, she knows it's placebo, but the unconscious mind, on the other hand, is going to accept it as a real treatment. So even if she doesn't know, or even if she knows, the unconscious mind is conditioned to react to pills, right? And positively.
Right.
That's interesting. I wish that would work for me, because I don't think that would work for me personally. I've taken too many pills that have not worked. So, like, painkillers never worked for me, never. In my whole TMS thing, I kind of think it was a good thing because it forced me to really just go all in on the psychology. But they've never worked for me. I've never had results from painkillers.
And so Rita Labarbera and I, we joined our effort, and we created a website. It's called defeatcrps.com. And so we talk about people, people send us emails and ask questions. And sometimes I get on the phone and talk to people because they want to hear a live person, and, to assure them that what they have is in fact TMS. And Rita, she's a coach, so she takes people and works with them. And so we keep discussing back and forth all these people who come to us. And our definition is this person hasn't hit the bottom yet. And I think you and I both ended up in a situation when we hit the bottom.
Absolutely.
We had nowhere else to go.
Absolutely.
But to Dr. Sarno.
Right. No other choice, because I tried them all. I did them all.
And then what do you do? You either believe and go all in, or you live with what you were given.
Right.
Untenable position.
Right. And if you saw my TMS roundtable, which I know you did, I talked about the moment my primary care doctor looked at me and was crying, and she's like, I don't know what to tell you. So at that point, I didn't have any options. There was no options. I was going to have to figure this out outside of traditional medicine. And I'm almost glad because, and not to be insensitive, like for people here who you guys have experienced at getting surgeries and stuff like that, because you can still heal regardless if you've done a surgery or 2 or 3.
Or you did a surgery and it pops up as something else.
Right. You can still heal, but what I was saying was that I'm glad that nobody offered me surgery. I never got offered a surgery. I never even got offered painkillers. They didn't offer me anything. I think they thought I was too young. They just didn't offer me anything. They told me to take ibuprofen, which I would try, and it just would never work. It never touched it. I would take Advil. That never worked. Not even a dent.
So this is the situation where you have been offered nothing else. In my case, I had a diagnosis, They gave me diagnosis. I went to like 5 or 6 different doctors, and they all kept telling me, what you have is carpal tunnel syndrome. Um, and for carpal tunnel syndrome, they have standard procedures. You can get physiotherapy, you can get, steroids. If steroids don't work, you can get a surgery. But my symptoms did not match. And I go to the doctor and I go, okay, these are my symptoms. I have these 5 different symptoms. Do they match the picture of CTS? And they go, well, not really, but what you have is CTS. And so whatever they offered didn't make any sense to me, because why would I take treatment for something that I don't believe it is that something?
Yeah, right. They're giving you treatment. They don't even have the diagnosis, and that's what Sarno said about TMS: is that we're successful because we have the correct diagnosis. It's not even really about the treatment.
Exactly. Exactly. And then the funny thing is, I go to a neurologist once I learned about CRPS. I somehow my brain really demanded that I get proper diagnosis, even though at that point I knew from Sarno's book that CRPS, in his opinion, was TMS, but he didn't have enough statistics, he didn't have enough patients to reliably say that. So my logic, my brain's logic was, first I need to make sure that what I have is CRPS. I go to a neurologist who diagnosed me with CTS, and I put in front of him Budapest protocol, which he didn't know about. And Budapest protocol is a very simple algorithm, very simple logic. It's out in the open on the internet, where you basically add up certain symptoms and you get the answer. And he looked at it and said, yeah, what you have is CRPS, but you also have CTS. And therefore, would you like to get steroids? And I said, no.
Right. Good. Yeah. Because if you have both, that just means it's all psychosomatic.
Exactly. And
Right.
I'm pretty certain that in majority of cases, carpal tunnel syndrome, which is highly prevalent condition among office workers, most likely, if you got CTS, you have TMS.
Absolutely.
It is not because you so overworked your hand typing on your keyboard. It is because you are overstressed.
Right. So what I was gonna say is when you said it's not because you're overworked with your hands. Maybe you are overworked, but it's not your hands that are overworked. It's your
brain.
nervous system. Yes.
Exactly.
You're too stressed out. You got a stressful job, right? And yeah, carpal tunnel is a whole other rabbit hole. It's like it's TMS, but then the awareness of it is like makes it more prevalent because it's an easy symptom for the mind to create when it needs to. Unless the awareness that we're spreading is that it's psychosomatic. Now that dismantles the brain's motivation to try and use that. Anyhow, thank you so much for sharing your journey so far in the medical merry-go-round. I always find it baffling how like patients have to educate their doctors sometimes. I mean, the fact that you had to bring in a paper with the Budapest criteria, it means that this doctor's not continuing his education. He got his degree, and that's it. He thinks he knows it all, and I hate that.
Oh yes, definitely. And they're closed-minded. And then I don't know if you want to talk about pain management clinics.
Oh, yeah. Let's touch on that. Let's touch on that briefly. Let's do it.
So I did naively, I thought that pain management clinic is a place where they help you manage yourself out of the pain. As it turns out, pain management clinic is the place where they just pamper your pain forever.
Right.
They just teach you how to cope. You accept your pain as inevitable, and they help you deal with it. What amazed me the most about pain management clinic was that they're using similar tools. The pain management clinic I went to, they had a psychologist. They had 3 psychologists, and they had classes, and they were doing meditation
Mm.
in the class. And as I was sitting, but the meditation in the class is last 5 minutes. And yeah,
What
instead
kind of results are you going to get from that?
instead
Yeah.
yes. And so this is kind of amazing that that whole idea of pain management clinics came out of the discovery that somebody made in early 70s, that there are so many people who just have no other symptoms but just pain. Everything look healthy, the bone is not broken, the spine is healthy. Why would they have pain? Which means that pain is a disease by itself.
Oh
And
my
if it
goodness.
is a disease by itself, because in Western modern medicine, we assign a special doctor for hand, we assign a special doctor for ears and eyes and feet, and podiatrist doesn't work above the ankle.
Right.
We need to assign a special doctor for pain. So
Right.
guess who is specializing in pain? Anesthesiologists, because they know how to kill the pain by injecting powerful painkillers into your system. And so, guess what? Now you have this merry-go-round that will go forever. This is self-propelled machine, because they start giving you all these painkillers, then you become addicted, then they have to treat you from addiction, and guaranteed income forever
Right.
until the death you part. Uh, and so, anyway, pain management clinics are a really dangerous place. Even though they seem to have psychologists, but those psychologists do
They don't
something
understand
that
TMS.
they
Yeah. And
no. As a matter of fact, when I was at that pain management clinic, I actually tried to work with them because they were open-minded to the idea of TMS. But the director of this pain management clinic, anesthesiologist, told me that he doesn't agree with Dr. Sarno. They knew about Sarno from the patients, most likely. I said, no, Dr. Sarno is too radical. I don't think so. And when he said that, the thought that I had in my mind was, how come that there is this website, Thank You, Dr. Sarno? And I've never seen a website, Thank You, Dr. Such and such.
exactly. That was a big thing for me. That was a huge thing for me, because what I started to see in my own research with my own issues is there's all these studies. There's all these studies, right? Studies are important. But if you don't see the evidence of the studies translate into real life, it's probably because the studies are bullshit. And with the CTS, I already told her. So if she watches this video, it's okay. But good for her. She got CTS surgery and it worked. But oh my goodness, I lost my train of thought. So we were talking about the studies. So when I looked up the studies for CTS, it said the success rate was 90 to 95%. But then right after, it said reoccurrence happens like 5 to 50% of the time. Well, if reoccurrence happens 50% of the time, how the heck are they able to say it's a 90% success rate in the first part? And then on the other hand, I also have seen people who have CTS surgery who are still in pain. The pain came back, or it's just symptom imperative. So what you said is so true. With the Sarno, you have real life examples like thousands, probably millions of other people who have had success. Where with these other doctors, you don't have people that are proclaiming their works. You don't have people that are success stories like the Sarno. So it's funny how they disagree with Sarno and they don't have the results. It's hilarious, actually.
Yes. I think you touched up on something very, very important. The definition of success. What is defined as a success? And this is how all these studies muddy the water. You said it all very well. that they define success as temporary relief.
That's not success. Yeah.
That is not success. Success
Absolutely.
is when remission becomes either very long lasting or permanent. If remission is 3 months and then the patient has to come back for ketamine injection or another denervation, so that is not success. And
Absolutely
this is how they manipulate the results, because they're trying to prove that their treatment is a good one instead of being truly open-minded and saying success is a complete disappearance of the symptoms permanently. Although it would be very hard to conduct a clinical study that would have a reasonable duration if you watch the patients that have disappearance of symptoms for the rest of their lives, because then your clinical study has to go on for many, 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 many years. And considering that big pharma only has this much of a life cycle for clinical study, they can't afford that. And that's why they start fudging the results.
Absolutely. Absolutely. And another thing to consider is that people, when they're not in pain, like they don't want to be at the doctor's anymore. They don't want to keep going back to a study.
Exactly.
And there's so many people that have been cured with sarnal stuff that actually don't even like report back to anyone. They just move on with their lives, you know?
And I applaud you. Being so young, you dug so deep in the definition of success rate, because it's not there on the surface. You really have to dig and dig and dig and dig until you come up with a real success rate.
Right. And I was not willing to accept anything less. I wasn't willing to accept anything less than a cure. And, even Steve Ozanich in his book, he talks about the pain clinics, how he would see the same people every time. He'll see the same people there. It becomes like a club. I don't want to be a part of a club. I don't. I don't want to be in the pain club. I want to be in the cured club.
Exactly.
And yeah, and the difference with like the doctors who have the TMS cure is they're trying to get you out as quick as possible, not keep you coming back.
Yes. And speaking of which, actually, the doctors who switch to TMS practice, they end up losing money. Dr. Schubiner, he keeps joking, I lose so much money because I don't send people to surgeries. There is another doctor, Hanscom, who was a very successful orthopedic surgeon raking in big bucks. Guess what? He stopped.
Right, I'm aware of him. Yeah.
Surgeries, and he's now making a pittance compared to what he used to make. And guess what? Patients love him.
Well, the surgeries are like 10 to 20 grand. So absolutely, and that's another thing that helped me to trust these doctors is that I know they really care. Some of them, their consultations are like 2 hours long, 3 hours long, and they're not getting paid extra for that.
No,
they're not. Yeah.
And Dr. Schubiner is a saint because he only works with patients in the state of Michigan. Guess what? He takes phone calls from people all over the world for free.
He's helped me personally. He's responded to my emails, and he doesn't have to. Yeah. What doctor does that? Well, that was the thing. Who does that? I'm like, doctor, I'll fly out there. Like, I don't care. He's like, no, but I'll answer your questions. But who does that? Like, most of them would just be like, oh, sorry, like, let me refer you to someone else or whatever. But
yes,
he's willing to answer questions. It's good because sometimes there are some really rare TMS symptoms that you just really get caught off guard. And that's why these doctors, like, with clinical experience are useful, because they can tell you if they've seen it or not, because they've seen thousands of patients. And chances are even the rarer symptoms they've seen before because of their experience in the clinic. So yeah, absolutely. These doctors, they're doing it from the heart. And that, it's proof too that not all doctors are bad. There's a lot of doctors that do care. about their patients. They care about continuing their education, right? They don't stop reading once they graduate. They keep going.
There is something else. These doctors are honest to the core professionals. When they see a fact, they take it as a fact. When the facts do not add up, they start asking questions. And that's a major difference between them and the other doctors who just work with the schemes that were given to them with some kind of algorithms because insurance company approved this. These people are not afraid to go against the flow because they are honest professionals. And that's,
Right.
yeah,
And that's what a scientist is. That's what a scientist does. Don't call
exactly.
yourself a scientist if you're not doing that, because you're not. You're a phony. Right. If you're not asking questions, you're a phony. You're not a scientist. If you want to just be, I mean, I guess if you want to just be like an average in your field, I guess that's okay. But I don't know. I think these things should be prerequisites if you're going to be a doctor. Don't be a doctor if you're not going to continue your education. I'm very passionate about this stuff because,
Oh, so am I.
yeah, it should be a and so should courage. If you're not courageous, don't be a doctor because you need to be courageous when your patients are not courageous, right? And that was one of the marks of Sarno and Schubiner is they will tell you with confidence what they think is going on. And even with Sarno, like I love Nicole Sachs' story about how she handed him like all of her MRIs and stuff and like he tossed them in the trash. Yeah.
Yeah, there is something else that sets TMS doctors apart from uh, the medical medical go-around doctors. They respect their patients as human beings.
Yes.
The doctor who gave me CTS diagnosis, she did not respect me at all. She was the one who knew everything, and I was just a little spoke in the wheel.
Yeah.
And as opposed to, for example, Dr. Roger Geisen, who was TMS neurologist who I went to help me to determine what I have. Is it TMS? Is it not TMS? Um, he respected me as a human. I had 1 hour paid consultation with him, 1 hour. And we have a friendship that continues on 5 years. He was the one who told me, you need to write down your story. I said, well, I'm already writing my book. He's trying to help me to publish it through the publishing house because I sold
Wow.
it on Amazon. Yeah. So he sends his patients, he gives them my book.
There you go.
Yeah. And so he respects, I spoke to one of his other patients, and it's the same thing. He respects his patients. That's a huge, huge difference.
Yeah, well, he respected you as an intelligent human being, not this I'm the doctor, I'm above you type of deal, it's that's in every field. There's people who they think because of their credentials or whatever that they can add more. When sometimes there's people who, because they're new, they can bring intelligent ideas because they don't have the indoctrination. They don't have that past indoctrination that they were taught. So great point. I wanted to speak with you about you finding TMS. When you found TMS, was there any skepticism or objections that you had?
Well, I have a math in my background. My degree was in applied math. I worked as a software engineer and analyst all of my life. So questioning things is sort of a second nature to me. So of course I questioned it and I asked questions and I tried to break this whole concept from different angles. Um, and then eventually I realized that it was solid. It had solid foundation. I read books. I read the book that was really helpful to me was written by psychiatrist Norman Deutsch, The Brain That Changes Itself. He talks about uh, sort of TMS theory from the neuroscientific angle, and
Mm-hmm.
he doesn't call it TMS. I don't think he knows about Sarno and his theory, but there is a lot of the same overlapping concepts. There was Robert Sapolsky who helped me immensely. There were other books, there were other materials that I found. There were some amazing, extremely intelligent and knowledgeable people on the TMS forum, where I would imagine, Joseph, you also.
I spent a lot of time on TMS forum.
Yeah. So, and so
Yeah.
all these people, their wisdom really helped me in really
Yes.
speeding up the Sarno concept with all my doubt and starting eventually believing that it is very solid. And then, as far as doubts go, there was another side of the doubt. The doubt was whether I will be able to apply this concept and get myself out of the deep hole I was in. And
So it sounds like you didn't have too much trouble accepting TMS. More of the trouble came from, am I going to be able to apply this?
exactly.
Okay.
And this is where, oh my God, we're running out of time.
I
Um,
know. Oh my goodness.
yes. So this is where uh, TMS personality is getting in the way of recovery, um, because we are obsessive people. Once we get onto something, we start obsessing. Am I doing it exactly right?
Oh my gosh.
The Sarno's book that I used was Mind Body Prescription. And one of the examples he has in his book was the guy who recovered using Sarno's method. And then he helped his coworker do the same. So the guy wrote step by step instructions in a very stern, very rigid language. And the whole point was step to the left, step to the right, you fail. You have to be precise with your instructions. So being a perfectionist, being an obsessive perfectionist, I had to follow every instruction to the T. And my fear of pain, my fear of CRPS, my fear of failure was amplified by my
Oh
fear of
yes.
not following instructions to the T.
Yes.
And my meditation practice was a nightmare because I was trying to follow instructions.
Oh my
I
gosh.
actually, yeah, I actually offer a free meditation session for people on the forum, where I tell them, stop obsessing, stop following instructions. I call it unguided guided meditation, where I tell people, stop following the guidance, find your own way. And only after that, after I figured out that, yes, I have to figure out my way because my way is the right way for me. It may not be the right way for somebody else, but it will be the right way for me. And I just gave up all the instructions. Heck, meditation is not necessarily sitting cross-legged on the floor with your back absolutely straight, because you're sick, you're in pain. Sit in whichever way it works for you. Do not count to the count of four. Do whatever, and that's when meditation starts working for me. And
Yeah,
it
I
was meditation that broke through my prison that my mind put me in.
right. And it's so funny because when I read your book, I saw the part on meditation, and I thought I was the only one. It was like, I swear, when I would try the guided meditations, it's almost as if my body, like they would give an instruction and boom, I would get this more anxiety. And it's almost like my body was like, don't tell me what to do. Like, it was like they were giving instruction, like my body's reacting, like, don't tell me what to do. And you said something like in the book, like, I think some TMS people are just too uptight. Like, they're so uptight that when you get an instruction, it just irks you. And even, I think this is even just a common thing with the TMS personality in general, is you don't like people telling you what to do.
Exactly.
Yeah.
It's type A personality. That's who we are.
Yeah.
We're obsessive. We're paranoid, and we're usually strong.
Huge egos, though. Huge egos. So it's
Yes,
like, don't tell me what to do.
exactly.
Yeah.
Yes.
Right. Yeah, I love that part. And You know, Tamara, I don't know if you have an extra 15 minutes, but
We can stay for another 15 minutes if you
okay,
want.
we can cut it off at 11:15 because I think we're about to get deep here. Because dang it, it took us this long to get here, and I think we're literally about to get deep here. So I want to get into this. Are you okay with extending it 15?
Yes.
Okay, we'll cut it off at 11:15. Okay, so yeah, I know meditation. I know meditation was a big part of your recovery because you needed to get your mind to stop ruminating on so many different things. I can tell from your book that you were just a constant worry. You're worrying about everything. So I want to dive deep into that. I have a few quotes from your books right here that I want to pull out on that topic. So this is such a catch-22, and that's the word you use. It's such a paradox. This concept of like having to put in work to recover, but also the TMSer has a perfectionistic personality, which only ramps up the nervous system and puts it in a fight or flight. So there's a way to go about this where you still have to put in the effort, but also not be perfectionistic to the point where you're just delaying your recovery because you're always worried about doing everything right. Am I doing the right meditation? How do I mean, it gets to the point where you're like wanting someone to tell you how to live your everyday life when you're desperate for recovery. And this quote right here from your book says, if you got sick by overworking your mind and your body, work less to figure out how to rest properly. But at that time, I didn't know how to relax. This is what you were saying. This is clearly a catch-22. To motivate myself, I had to doubt myself. But to recover, I had to believe in myself and relax. In order to recover, I had to work hard on relaxing. Well, that statement's funny right there. Work hard on relaxing. But my obsessive desire to work hard on everything could have been a root of my problems to begin with. So, right, exactly. Your work ethic, God probably contributed to you getting TMS, but then on the other hand, you still have to put an effort to learn how to relax. Touch on that.
So this is when I give that meditation class to people, I usually tell them, we view the world from the lens of our own mind, right? Our own understanding of the world. And we believe that all this uptightness and rigidness and perfectionism is a norm. No,
Yes.
we're not the norm. We need to
Yes.
understand that our desire to have everything perfect is actually at the end of the spectrum. So whenever we develop
Absolutely.
our method, we really need to have to make that mental adjustment. And it is
Absolutely.
interesting. I started making mental adjustment. For example, I used to absolutely freak out when at work I would be double booked for meetings, sometimes triple booked. And I would be stressed out and I would put enormous amount of effort to reschedule one of those meetings so then I can attend the other meeting. And eventually I realized that more often than not, the other meeting would be canceled or moved. And I made a tremendous effort because it was very hard. I had to overcome my nature, do nothing, just do nothing. And one of the meetings would disappear. Guess what? Every time the situation resolved itself without that frantic effort that I used to put into it. And I use that as a teaching example, as a teaching experience. So next time I would loosen up with something else. And I consciously started loosening myself up. Let go. If it doesn't work out perfectly, heck, it will work out somehow.
Yes.
And so that was one of the changes that I made. Thanks forever to Dr. Sarno, I became much less obsessive in my lifestyle. And it really helps. It really changes the way the world responds to me because, the action, your action causes reaction, right? So if you're rigid with the world is rigid with you. And then
Oh,
it's
yes.
self-propelled prophecy. And so by observing yourself, by being mindful, you realize that you shouldn't be as uptight. And so with meditation, for example, I started caring less. And I started following a very simple rule. There is no such thing as bad meditation. Whenever you spend 30 minutes with yourself, it is healing your nervous system. Take it.
Yeah,
So am I answering your question?
absolutely, absolutely. Um, and I mean, you indirectly answered it, because what my whole thing here was that you still had to apply effort. However, the effort was applied towards applying less effort.
Exactly.
I'm sure it took work to break that habit of doing and learning how to do nothing. Well, I'm sure it was hard. Like, I'm sure you had your body screaming at you, saying, "What are you doing? We need to take action," right?
My response was fear. Oh my God. If I break the rule, what is going to happen? The
Yep.
world is going to collapse. I will be put in a terrible position. I will be embarrassed. My ego will absolutely suffer. There is ego underneath everything. Once you
Yes.
start treating yourself and your ego with a little bit of humor, and you start laughing at yourself,
Yes.
things change. And, Dr. Sarno was saying that you don't have to change yourself in order to heal. I disagree with that.
I do 100%. I agree with you.
It's who we are gets us into that condition of pain. And, some people never get into that chronic pain, right? People with different kind of personality. But you know what? They have other problems in life.
One of my favorite points in your book was that I totally, and Sarno was a genius, but that's one of the areas I disagree with him, is that you don't have to change your personality. And there's people that are still saying that. I don't agree with that. Your personality is the reason that got you here. And that's why.
I'm sorry for interrupting you. I would like to clarify that you're not changing your personality, because personality is your makeup. It's your psychological makeup. You observe your personality and you intercept your reactions.
Yes, yes. So yeah, when I say your personality, I just mean the you don't always have to agree with your personality and let it run your life. So yes, you do intercept, and you take a different action. So in your example, with the work example, your personality is to reschedule those meetings and to try and fix it and make it work. Intercepting that is saying, "Hey, I hear you, mind, body. However, we're not gonna do that. We're gonna do something else." And that's why I think also too, the advice of like, just go live your life, that a lot of people in this space say, I also disagree with it. Because the way you've been living your life is what got you here in the first place.
Exactly.
Why would we tell you to go back? And you're just gonna get triggered with pain. And I there's so much proof of this. One example was Arlene Feinblatt. I saw her talk in an interview about how they would bring these patients to the inpatient facility with Sarno and Arlene Feinblatt, and they were helping them recover. They'd recover, they'd go right back home, and their pain would come right back. Because when they went home, they were still acting the same way that they did. When the pressures of life came to them, they still reacted in the same way. And that would, because of their personality. So I do agree with you that we do need to change our change our personality in the way that we're saying, as far as like, stop letting it run your life, stop letting your perfectionism run your life, because what perfectionism leads to is working 12 to 16-hour days at your job, making you believe you have to fix everything and everyone around you, and that's going to put your nervous system into fight or flight. And I love what you said about we normalize these personality traits throughout our lives. I thought that perfectionism just was a good thing. I thought that it just meant that it makes me a good person. And that's where the goodism comes in, right? It doesn't help that a lot of these personality traits are actually praised and encouraged by the people around you. Nobody's going to give you shit for getting straight A's and, in my example, and playing basketball and having a social life that you're going to get called a good kid or a hardworking kid. So the normalization of these with ourselves and by other people perpetuates these, and it needs to stop. You need to get to a point where you are not normalizing perfectionism and you tell yourself, this is not normal or healthy, and this needs to be addressed. And that's, yeah. And I can tell in your journey, Tamara, that's what you had to do. Is you realize, you said, if I would have healed by reading Sarno's book, it would have happened already. If I would have been just a knowledge cure, because that happens, the knowledge therapy that Sarno talked about, it would have happened already. And it's the same thing with me. I've known about this for like almost 2 years now. I would have been 100% better if I was a knowledge cure. I'm not. I'm still working on things. I'm working on being less perfectionistic, on realizing I don't have to be perfect. I don't have to be a good boy. I don't have to please everybody around me, and many, many other things. Because for me, it's a lot of things. Because this is where my personality has gotten me in my life. It's created my entire life, and now I'm changing it, and that takes time. Which is another thing I want to talk about, which is taking the time that it takes. And I am going to pull some quotes from your book as well, because even when, let's say you're watching this and you're deciding, you're agreeing with Tamara and I that maybe for me I'm going to have to change my personality, and you're thinking this. Well, I want you to know it's like not going to happen right away, even when it comes to fear. So I know for you, Tamara, a big thing was fear. Fear of losing your job, fear of this, fear of that, and you wanted to work on changing that. And this quote from your book says, "It was around that time that I wrote a long farewell letter to my fear. It brought me some relief, but the actual farewell took months. Much like pain from a bad marriage does not end when a dissolution of marriage is recorded by the county clerk, my divorce from fear became final long after I wrote that letter." So it takes time, right? It takes time.
Everything has to become yours on a visceral level. The knowledge that of TMS, the knowledge of that whole concept, if it is only on the intellectual level, will not cure you. You have to absorb it on a visceral level. I noticed that after I recovered, my reactions, I view things in life from the perspective of TMS. I became sort of a psychologist in a way. When I look at people, I view them a lot of times as a psychologist. It's almost instantaneous, automatic reaction. It became part of me, not an abstract concept. And I think this is when you start really recovering.
Yes. And that's why when I first read it, I gave like the best advice that I didn't follow. Like I would tell people, oh, you need to take a break from work. Like, that's why your neck hurts. And then here I am working 12 hours a day, right? Like the perfectionist that I was and the workaholic. So yeah, absolutely. Making it visceral and a part of your life is going to take time.
And learning how to take a break.
Yes.
Because we take a break, we don't show up to work, but in reality, it's still rolling through your brain, right? So if it is still rolling through your brain,
it's not a real break.
It's not a break.
Right. If you're at work, if you're taking a break and you're sitting there feeling guilty about taking a break, it's not a real break. Your nervous system is still on fight or flight, right? And that's where, you put forth effort to retrain your mind to start accepting taking a break. And for me, it's taken a lot of effort and like over and over reassurance. It's okay, brain, it's okay. And I actually wanted to make a video about this. I'm trying to be to myself now, kind of like that grandma that kind of spoils you when you're with her and does all the things your parents don't want you to do. So for example, let's say your parents didn't let you eat cookies growing up or something. Well, you go to grandma's house and she's like, don't tell your mom, it's okay, like eat these cookies. That's how I'm trying to be to myself when I take a break. So like, hey, don't worry about what super ego is saying to you right now that, oh, you can't take a break, you gotta work hard for what you want. Like, it's okay, you can take a break right now, don't worry, I'm not gonna tell super ego, like, super ego's not here right now. Do you get what I'm saying?
I love this. I love this analogy. Become your own grandma.
Yes. Yes, and obviously you don't want to do that all the time because then you're going to be a fat kid who eats cookies all the time. But there's, you pick your times. There's a time to be the strict parent. There's a time to be the grandma. You know,
Exactly.
absolutely.
Very good analogy. I really like it.
Thank you so much. Okay, and last thing I wanted to touch on before we go here is the nonlinear recovery. So extinction bursts and plateaus. I really wish this was talked about more in the space because it's not. It's really not. And you give a whole timeline that it gives such perspective. And when I first read your book, I honestly I was like, fuck, I hope that's not me. Like I hope my shit doesn't like behave like this. I want my recovery to be linear. But I see that for a lot of people it's not. So I want to give one example of extinction bursts and plateaus that you put in your timeline. And in the book, you mentioned that both extinction bursts and plateaus can sometimes last weeks and months. And there's one that from January 2017, and this was after a plateau of 3 months. So you had a plateau of 3 months before January 2017, and you had an extinction burst that continued for 4 months. So before I even keep going, you had an extinction burst that lasted for 4 months?
Yes. So I'm just looking at my book, trying to find that one that.
It's in the recovery section.
No, I know. I'm looking
Okay.
at the timeline. Can you tell me which one you're referring to? Because I have so many. What?
January 2017. So it says frequency.
2017. Okay. Yeah. So for several months, I would wake up to a cramp in my leg, or it would catch me in the middle of the day, or it would be, I would just get up out of the chair, and all of a sudden my leg is cramping up. So all that scared me because my main symptom was dystonia, which is sort of a permanent cramp in the hands. Basically, the hands kind of froze in a claw position. I couldn't open my hand. I couldn't make a fist. So they were just stuck like claws. And so I started worrying that this muscle spasm that happened in my hands was spreading everywhere, except instead of permanent, it became temporary, just short-term bursts of pain and spasm. And that scared me. But thanks to Dr. Sarno, forever grateful, he warned me that it is possible. It is extinction burst. Just let go of it. Stop obsessing. And I stopped. And for several months, I was getting those spasms. One of the spasms that I had, I don't remember if it was during that period or some other time. I woke up with severe pain in my back and feeling almost paralyzed. Pretty much, I could not move my shoulder. I could not move my back. I had to crawl out of the bed. I barely made it out of the bed. I kind of fell on the floor on my knees, tried to get up. I couldn't. It was a really, really strong spasm and very, very painful. It took me several hours to kind of undo it a little bit, loosen it up a little bit so I could actually go to work. And at work, I literally couldn't move my arm. I couldn't move my shoulder. I was barely able to get dressed. So if I didn't know about extinction bursts, I would have been terrified. I would have been terrified. That would have triggered fight or flight response. That would have triggered fear again. But I knew that
maybe perfectionism too, because what if I'm doing something wrong? What if my body's telling me I need to change?
Exactly. Yes, I did something wrong. But by that time, I was far enough in my recovery, so I didn't take it very seriously. I just calmly responded to it. I knew it will pass.
Wow. And that is 4 months is a long time though. I think after month 2, I would be like, oh, I'd start questioning.
The worst extinction burst was fibromyalgia kind of a thing. I didn't bother to get a formal diagnosis. I found, I read up on the definition of fibromyalgia. It was like 90 to 100% fibromyalgia. And that thing lasted for probably at least 4 months, if not longer. And that was so unpleasant. I understand why people with fibromyalgia are so miserable.
Yeah, that's a serious, serious
Yeah.
condition.
And at that time, I wasn't as, well versed in my TMS theory, and I freaked out. That was the time when I started throwing money at it. I went to all kinds of like healers and, some really strange people who promised, to look in my eyes and get me cured in 20 minutes.
Are you talking about the iridology? You tried that?
I don't even
And then they look
remember.
into your eyes?
No, not that,
Oh,
not that far. But
okay.
I had some really strange, energetic energy treatments and massages and all that. None of it worked, and so thanks God, But it cost me a fair amount of money. I don't know, definitely upwards of $500 because I was throwing money at it. And one
Yeah.
thing I know, throwing money at your condition is the stupidest thing you can do.
Well, I love what you said in the book that the extinction bursts had led you to doing some really irrational things, and the plateaus as well. Both of those have led me to doing some really irrational things. Looking back, those were the times where I started like trying weird stuff. Like, yeah, so I totally get what you're saying. You need to stay the course is the point. You need to
Yeah.
stay the course. It doesn't always mean you're doing something wrong. And that's where you said, people, how do you know the difference between an extinction burst and a plateau versus like you really are actually, you need to make a change. And it's a tough question to answer. And that's where a coach or a therapist can really help because they can tell you it's somebody outside yourself, because sometimes we need reassurance. We're human beings and we need that somebody outside of ourselves who's experienced, who's gone through this, who knows how to help this and tell us, you're on the right path, just stay the right path. Or they can maybe find something where maybe you can improve on. But I think we need to normalize extinction bursts and plateaus as well. That's the point here, is that it's normal. It's a part of recovery for some people, and you have to be patient. I mean, these are 4 months extinction burst, 3 months plateau, another extinction burst, another months. But stay patient, stay focused. I love that. Thank you so much, Tamara, for coming on and staying on. It's went a little longer than we thought, so I appreciate your flexibility. I do want to plug you here. Tamara does do coaching, is that correct?
I do not do coaching, although
Okay.
Rita keeps telling me that I should. Again, this is my perfectionism. What if the person who comes to me doesn't really recover? And and so it's not even I would give them money back, but it's the sense that I did not succeed. That's what bothers me. So I basically answer questions. People call me, people send me emails, and I spend time with them, but I do not formally offer coaching.
Okay, got it. And do you like, is this a service that you charge for?
No, I don't charge for the service.
You are just a saint.
It is interesting. Someone who called me multiple times told me, "Are you doing this? Are you doing this out of kindness of your heart?" And I said, "No, I'm doing it out of the anger." And my anger is at the official medicine that gets people to this desperate condition. And I really want to get at them. I really want my revenge on them. I don't know if that's more plausible explanation than me being a saint.
Well, saints are angry at the devil. So
Exactly.
in
Yes.
this case, your work, you can use hate and anger as motivation if in a healthy way. The goal is to direct it in a healthy way. These emotions exist for a reason. Let's use them to their advantage instead of letting them destroy us, right? So, I mean, I just want to say, well, I didn't know that. I really appreciate that you do that for the community. I mean, we're lucky to have people like you in the community doing this, and also all of your writings on the TMS Wiki. We just thank you. So yeah, however people can contact you, we'll put that in the description. We're also going to have Rita on this episode. So she offers coaching for the people that want kind of something structured like that. They're good friends with Tamara. They have a blog together. Outside of that, is there anything you want to leave us with, Tamara?
As far as reaching out to me, you can reach out through defeatcrps.com website, and I will get notified. But before I start spending 24 hours a day answering questions, because as the book gets out, people contact me, and so I'm already spending substantial time answering the questions. Please read the book before you start asking me questions, because I seem to be repeating the same thing time and over to various people. And honestly, everything I know about TMS is in the book and on the website, in the blog. And I will be working on the second edition of the book, because people ask questions and there are interesting thoughts and ideas that come out of it, and very interesting observations of the people who reach out to me. So please, if you're trying to reach out to me, do me a favor, read the book first. It will make my life much easier.
Yes.
My service to the community will not be as exhausting as it sometimes is.
Yeah, don't ask her questions that you can find in the book. Yeah, yeah. You heard the woman. Okay.
Yeah, and Joseph, I really enjoyed the interview, and I would say you probably were one of the most deep thinking readers of the book, because the depths of the questions that you've been asking and the points in the book that you zeroed in on, that is very remarkable, because a lot of times people ask me very superficial questions, and you are just digging very, very deep. Thank you for your questions. I hope they will help other people.
Thank you so much for the comments. I appreciate them, truly.
Yes.
You have a great rest of your day. Thank you for coming on.
Thank you, and good luck with your channel.
Thank you so much, Tamara. Have a good one.
Okay, so great interview with Tamara. Lots of gems, lots of topics covered. She definitely wasn't a book here. And you guys are going to see, neither was Rita. And that's why talking to people like this is so important, because there are also many people out there who are not book cures, and they've tried already lots of different things. They know they have TMS, but they're in an area where they need some next steps. And so I hope you got some of that from tomorrow's interview. Next, we're going to bring on Rita. Rita also dealt with CRPS, like I said, and she also gets very deep into her own personal journey. A lot deeper than I actually thought, but it's going to be so valuable. And I really just thank Rita for being so brave and sharing so much of her personal life with us, for us to benefit from it, and for us to really see this is TMS. TMS is deeply personal. It's dramatic and emotional and sad and all of the Philly feelings. So we'll bring her on, and I'll see you guys after. Okay, hi everybody. This is the Young Money Talk Show. We have another Mind Body interview today. I'm really excited for this one. We interviewed Tamara, and now we're interviewing her friend. They both defeated CRPS. This is Rita right here. Rita, thank you so much for coming on. Rita's going to share her story today about how she overcame CRPS, and she's also going to talk about some topics that she wants to share, some recovery insights. So thank you for coming on. How are you today?
Oh, thanks so much for having me, Joseph. I'm really super excited to be here, and I'm so honored you asked me. And I think you and your channel are destined for lots of great things. So I'm excited to keep an eye out on that on the horizon.
Yeah, thank you so much. I really appreciate having you here, because you and Tamara, because CRPS is one of the least common TMS manifestations. And it's also one of the more severe, in my opinion.
Is that what you've noticed as well?
Yeah, so it's really, it is the most dramatic manifestation of TMS, in my opinion, because it's so visual in nature. You have actual physiological changes, and it's really, they describe it as a disease of primary pain, which of course is misleading because, as we know, it's a symptom of something underlying psychologically. It's psychosomatic, but we know it's psychogenic. But in the medical world, it's considered a disease of pain, which is quite bizarre. And to them, it's very unexplainable, incurable, unremitting. When in actuality, it's highly treatable, highly reversible, and highly explainable. So that's why I'm thrilled to be here to get that message out to anybody who might be suffering, or anyone who knows of, has a family member or friend who may be suffering. And I just think that your channel, Joseph, is going to help a lot of people. So
Thank you. And then, so you said primary pain. Does that mean that they think there is nothing else causing it? It's just simply pain and that's it?
Yes, it's quite mysterious in the medical world. They often attribute it to some kind of inciting event, a precipitating event, where the person has a disproportionate reaction to the event. So it could be, a surgery or an injury, or a very minor thing like a blood draw, or just bumping into a shopping cart, and then it spirals into this chronic pain syndrome. They actually have a protocol. Let me just see if I can find that note. They have this, maybe Tamara mentioned this, but basically this, okay, so we've heard of phantom limb syndrome since the Civil War. So this phenomenon has actually been known about for many, many years. But the diagnosis of CRPS, which used to be called RSD, used to take a very long time for the sufferer to get the diagnosis. They would often be misdiagnosed, as was I. I was misdiagnosed many times. But although they're more adept at diagnosing it nowadays, the treatments they offer are still totally ineffective. So they look at 4 categories. They look at sensory changes, such as allodynia, hyperalgesia, amplified pain. They look at vascular changes, like extreme color and temperature changes. They look at edema, like tissue swelling or bone marrow swelling, which I had all of the above, by the way, and also motor trophic symptoms, which affect a person's mobility. So I suffered from all of the above.
Mobility meaning you start to lose range of motion?
Yes. Well, really what happens is the sufferer becomes increasingly medicalized and terrified. And so they start to guard their body. They become more rigid. They become more fearful of movement. And so they start to guard, let's say it's one limb that's affected. They might start to guard that leg or guard the foot that's affected. And so it really reinforces this vicious cycle of fear, pain, fear, symptom, fear, pain, so it takes on a life of its own. And I definitely think that, it's so interesting how we're used to, people in the medical field are used to looking at body parts and organs and tissue. And in this case, the actual tissue is affected, but it's not in the tissue. It's the genesis is still the brain. So the issue is really in the brain, not the body part. So
right. Yeah. And was that protocol that you shared? Is that the Budapest protocol?
Yes, it is. Yeah, that's what they
okay.
call it. Yes.
Yeah, I read about it in Tamara's book.
Yes, her book I really recommend it. It's invaluable. It's called Defying the Verdict. So fortunately, we're on the precipice of a paradigm shift right now in medicine and in healthcare. And more CRPS sufferers are becoming exposed to this information of Dr. Sarno and the mind-body approach. It's slow, and they're newer to the party, but it's starting to occur. So that's very promising and very hopeful. And so.
Yeah, I think with you said CRPS, there's changes to the tissue, right? But it's still psychosomatic because the genesis is in the brain. So I think at some point, the way that the science is going is I think at some point we're going to have to come up with two different names for conditions that are the genesis starts in the brain. And it's going to have to be one name for the ones that don't have tissue changes, in my opinion, and one name for the ones that do, because you start to see a lot of arguments in the forum while like, oh no, CRPS, or not in the forum, in different forums, even amongst doctors. I've seen certain doctors say, oh, well, I wouldn't really call like CRPS TMS because there's tissue changes. And so they'll separate it from like the other conditions where it's literally just only nerve pain and there's no like physical changes going on. Do you get what I'm saying?
Yeah. So you're describing when you sort of have an invisible malady versus actual physiological changes and alterations. And I have to tell you, I've seen some really intense things in my life in waiting rooms, and I've spoken to many people and I've met many people, and you can see people with completely atrophied bones and limbs and lobster red. And I saw one woman who looked like she was covered in tattoos, and it was from all the vascular changes, extreme swelling. I mean, really things like that you would see in a science fiction movie, really blisters, oozing blisters, because you see the brain, after a while, these signals will alter a person's physiology because there's this feedback loop and it's getting incorrect information. The body's getting incorrect information. So the brain mobilizes liquid and blood and different resources to these areas, thinking it needs to keep you alive. It's really a mistake of the brain.
Absolutely. And I like what Dan Radner says. Anything that the body can do for different purposes, it can do for mind-body purposes, or because of mind-body reasons. And blistering is a response to like infection and stuff. So it's totally possible that blistering and all that can be done just by the mind by itself. If it wants to do that, or it's in such a state where it will just start to do that because of incorrect signals.
Yes, I mean, people have literally gone blind that weren't really blind. People have had paralysis who really, there was nothing wrong with their mobility, but they were paralyzed. So the brain is incredibly powerful, and it can really, as Dr. Sarno always said, it can trick you. It can trick you. And so our job is to not be fooled and not fall for it. And, I think at the heart of psychosomatic medicine is the concept that the physiology of the body can change due to psychological
reasons, right?
And so nothing surprises me, absolutely nothing. I've seen so much. I've spoken to so many people, and the brain controls every system, whether it's the nervous system or the digestive system, or every system of the body gets co-opted. It's really it makes sense, actually. It's not so surprising when you think of how we're designed evolutionarily. And even if you read a really great book is Molecules of Emotion by Candace Pert, and she describes how the brain, there are these chemical peptides, and the brain communicates to every cell in the body via these peptides. So we have the science to back up cause. We know the cause. The science is there.
Absolutely. And the fact that you can think of a symptom and actually bring it upon yourself is insane. That is proof of the peptides theory. Candace Pert, Sherelle, I interviewed her. You watched it. She has a video on her YouTube where she talks about focusing on one body part. And so she had this fear of, I believe it was sepsis, which is like an infection. She was like Googling the symptoms and she was really scared. and she was focusing. It might not have been sepsis, but it was something about, and she just started focusing on her leg. Well, her leg turned red and hot, and she said it was burning, like 9 out of 10 pain. They called the ambulance. The ambulance got there, checked her temperature. They're like, your leg is really hot, and
Right,
it's
of
red,
course.
and she's in like agonizing pain. You know,
Right.
thankfully the episode only lasted like a day, and so she was able to kind of recollect herself. But that is pure proof of like the peptides theory, and proof that the mind can control so many things. And one thing that people, I know I did, and a lot of people that have TMS say, is they're like, they start to think that there's something like systemic going on. And, you know, not to say that there aren't systemic diseases like autoimmune stuff, which in my opinion is also psychosomatic. That's another conversation.
It
But
does.
oh boy, I'm losing my train of thought here. What was I talking about?
The autoimmune, there's a psychosomatic component. Well,
Systemic.
imagining. So the brain doesn't know the difference between real or perceived.
Right.
Right? It doesn't know the difference between a real tiger or a paper tiger. So just remembering having, you know, if you're stuck in trauma, or if you're imagining something, or if you're terrified or afraid of something, it will bring upon symptoms in the body. And if you think about it, what is the most contagious disease on earth? It's fear.
Right.
And just you can catch fear. The converse would be you can catch belief. So if you can believe that this is in your control, you can just as easily reverse it. So it's really, we have to use an antidote to fear, which is knowledge and belief in the self, and belief in the body's innate wisdom and innate ability to heal. And I have a passionate belief that the brain and body evolutionarily are designed to be well and to heal, and it surpasses all conscious awareness even. So
Absolutely.
we have to get out of our own way, basically.
Yes. And I remembered my point too. So I was saying people, when they get TMS, they start to think there's something systemic going on. Well, it is systemic. It's your nervous system. So your nervous system, every part of your body responds to your nervous system, every cell, every hormone, everything. So yeah, it controls everything.
And the question is, what is ramping up? What is revving up your nervous system? Your thoughts and emotions, your fears and doubts. So it really is purely, you cannot treat a psychological issue with physical treatments. You have to treat this psychologically, and you have to think psychologically. We always have to address the cause, because the more we focus on symptoms, the more we keep the TMS strategy alive. But when we address the cause, we reverse the disorder. I hate that word disorder, but you know what I mean. The situation, the scenario. So
yeah. Well, I mean, there are things that do get out of order when someone's nervous system is jacked up, you know. So
yes.
I mean, disorder, dis-ease, you know, whatever the word is.
Yes. Discomfort.
Yeah, I mean, the nervous system can cause dis-ease, you know, discomfort, disorder, whatever it is, right? But it can be reversed. Yeah.
If you can create it, you can uncreate it.
Absolutely. And that's when people start taking their power back. So, wow, great so far. Thank you for the information on CRPS, some education for myself and the viewers. Now, if you'd like to, I'd like to get into like your personal story.
Sure.
Yeah, go ahead and share. I might interrupt you in the middle just if I have questions. Yeah. So go ahead.
Okay, where should I start?
At the beginning. I want like everything. So at the beginning. No, not your whole life, but yeah, the beginning of mind-body disorders is often like childhood events and stuff. But let's talk about the onset of the CRPS, like and shortly before.
Well, let's see. I might rewind and fast forward as I.
That's all right. I'm good at following.
My personal story. So basically, gosh, there were a few. So my childhood was quite idyllic in many ways. I had a very happy childhood. I grew up in a very loving family. But like every other human, you know, there were stressor pressures and traumas. Nobody gets out of childhood without that, in my opinion. I think so. You know, when you look at the word trauma, we need to kind of depathologize the word trauma because it's a part of life. And from the moment we first take a breath, that's actually a trauma.
I've heard that child like being born is like a trauma, which sounds so like nihilistic. It's like
right,
being born into the world is traumatic. Yeah, continue.
Yeah. So I think, I growing up, I had overall a happy, well-adjusted childhood. I think that, I did experience some very severe bullying in middle school. And I also had the personality traits that most TMS sufferers have. So I was always like a kid that wanted to please, especially authority figures like my parents or my teachers. I really always wanted to, do my best. I wanted to do the right thing, make others happy. I was, pretty much a good kid. I just read a lot of books. And so...
Still read a lot of books, it looks like.
Yeah, exactly. And so I strove to excel in school, in academics, and I always cared a lot about other people's feelings, like my peers, and I was somebody who would have never bullied anybody else.
Would you say you're empathetic as well?
Yes,
like
I was
empathetic?
very sensitive, very empathetic, exactly. And I was one of those kids where the teacher would always pair me up. Whoever was being bullied, they would pair me in different projects or
Wow.
plays or like school productions because the teachers knew that I wouldn't be mean to them.
Yeah, wow.
Yeah, so I haven't thought of that in a long time, but it's true. But yeah, so I think, most of my adverse events in life, the stressors really came about in adulthood. And it was mostly after college, I worked I went to graduate school, I studied counseling psychology, and I worked with high school kids, at-risk high school kids. I did that for a while. And I really enjoyed one-on-one with teenagers, as well as I ran groups for teenagers, like self-esteem groups for girls and conflict resolution, things like that.
You're always like a healer.
I don't know about that, but I enjoyed it. I guess I had the heart for it, you could say. And then, I got married, and so my problems really started. I did have a very traumatic childbirth with my older son. And I think that probably was my first severe medical trauma, and it probably started to prime my brain a bit. I think that's when...
Sensitize it a little bit.
Yeah, I think it started to... Yeah, so I had this horrific childbirth. I was left completely incontinent, and I had to have surgery. It was just... Technically, it was malpractice. So that was my first medical trauma. But I should rewind again, because after I got married, I had my first manifestation of TMS, which was I had these severe bladder spasms and bladder urgency, and I was diagnosed with interstitial cystitis. But at the time, I didn't know that was a mind-body. Dr. Sarno wasn't quite on my radar at that time. Fortunately, it did go away. It did resolve after about a year. But that was yes. Well,
yeah, some of these things kind of just do that.
But looking back, though, when I look back, when I first developed interstitial cystitis, there were some major life changes. I had just gotten married. I had moved across the country, and probably my brain interpreted that as stressful, even though it was happy stress.
Okay, I want to comment on that because do you know about the Holmes-Richter scale? I hope I'm pronouncing it right.
It sounds familiar.
It's like a list of stressors, like common life stressors, and he rates them like 100, 0 to 100, I think, or 0 to 10. Actually, getting married and moving are two of the highest ones. They're actually on the same level as like getting a severe illness, which is insane. Like how it's almost just like any form of arousal. The brain can interpret it as whether it's like positive or negative.
Yes, even happy events like having a baby, or these are huge
shocks almost, right?
Yeah, they're like mini earthquakes, and it's it can really have kind of a cataclysmic effect on the brain, I suppose, even when it's a positive life change. And so when I think back at when the interstitial cystitis kind of disappeared, we had moved again, and maybe something about the move triggered something in my brain, and I went back to my default setting of normal. So I don't know. When I look back, I wonder about that.
Did you move closer to your hometown or something like that when you moved again?
We were in Arizona. So I live in New Jersey. I'm from New Jersey, and initially I moved to Arizona, and that's when I developed the IC. And I liked Arizona quite a lot, actually. But
it's
then,
hot over there.
yeah, it's very hot, but I was happy. And then we moved to Chicago, and that's when it disappeared. And it's odd because we moved to Chicago in the dead of winter in January. It was like below zero. And it was maybe the shock to my system. I don't know, but.
Yeah, that's really interesting.
I think my brain was diverted. Now that I think back, I think it was a diversion. So I focused on other things, and then the interstitial cystitis evaporated.
I totally can see that, yes.
Yeah, so fast forward to the birth of my second child, and this is really where my poor brain, things started to take a toll. So my younger son was diagnosed with autism, and it's interesting because I think there's a lot of my journey as a special needs mom has a lot of parallels to my journey with chronic pain. It's very interesting, and in an odd way, my experience with autism kind of prepared me for chronic pain recovery, if that makes sense. Some of those experiences, I suppose they made me more discerning, and I had a different perspective on the medical world after dealing with my son's autism. So in a strange way, I think it helped me. So in a way, it created the sensitization in my brain, and it gave me a lot of stress. But in another way, it it prepared me.
How come?
In ways. Well, so I would say that it's ironic, I think when my son was diagnosed with autism, I really didn't know very much about autism at all. I had never met anyone with autism. And I came to realize quite quickly that the treatment options for autism are very meager and very ineffective. And they really don't know the cause. And it's, it's a very mysterious condition in many ways, just like chronic pain is. But the difference is chronic pain is reversible, whereas autism is another animal, And so what I found was I became really panicked and frantic, trying to, save my son from the autism, trying to recover him. And unfortunately, he became a science project because I went down a lot of rabbit holes of the biomedical model. There's a lot of, when you're a parent, you become very vulnerable to anything to help your child. And unfortunately, there are a lot of charlatans and a lot of alternative doctors that really prey upon the desperation and the vulnerability of parents. And so unfortunately, I went down a lot of those roads. And it's, by the way, incredibly expensive because insurance doesn't cover it,
The alternative stuff?
Right, exactly. Yeah. And then the other sort of abyss I went down was, so this is where there's a parallel. In the autism world, the gold standard of treatment or approach, if you will, methodology, if you will, the gold standard has been ABA, which is applied behavioral analysis, which was developed by Lovis back in the 1940s. And it is so antiquated and archaic and medieval, and it's really based on operant conditioning, which was, the founder of behaviorism was B.F. Skinner. So really, ABA comes from that that methodology of behaviorism, which is great for dog training or rats, but it's not so great for children, human children. So I went down.
What is the definition of behaviorism?
Well, that's a good question. Behaviorism is really about, they really look at behaviors and how to shape those behaviors through rewards or through punishment. That was the initial.
Okay. At the base, it's like
that,
pain and pleasure conditioning.
Exactly. Operant conditioning. Exactly.
Okay.
And unfortunately, the world of autism and ABA is really an offshoot of that to me, it's something from the dark ages. It really does not. The only time it really, I think, is appropriate, I believe that as a methodology is inappropriate for children. I consider it a form of, I'm going to say something really shocking, but I consider it a form of systemic abuse. This is the gold standard in autism world, is to use ABA. Having said that, elements of behaviorism can be appropriate and they can be okay in certain contexts. For example, self-help skills or potty training, or learning how to brush your teeth, things like things that are more of a behavioral in nature, right? Then it makes sense. But when it comes to acquisition of speech, reading, academics, personality, the physical body, behaviorism misses the boat completely. So they disregard the whole child. They only see the child as a constellation of behaviors, and they lose sight of the actual child. And the child has no context for their learning because everything's through the lens of this behavioral approach.
Like reward, punishment.
Yes, it's very robotic. And granted, they don't really do much. They don't do the aversive punishing thing as much, but even the way it's set up with the rewards, to me, is a form of abuse, because the child will have to do these things called discrete trials, and they're very into like graphs and charts, and it's quite dehumanizing. And so let's say the pen is blue, and the child has to answer, what color is this? And they'll have to answer blue 10 times in order to get a check mark on the graph, which is a very unnatural way to learn about the world and about language and about relationship. Like, it really misses the boat. So what happened was my son was sort of cherry-picked to be accepted into this school in New Jersey, which is considered like the best ABA school in the country. But really, it was sort of it was sort of an emperor with no clothes situation. Like, what seemed like the best actually turned out to be the worst decision I ever made, out of desperation, out of not knowing, just ignorance, and being told by experts that this was the best method, this was the best school. And so it's normal to listen to so-called experts when you know any better. And so what happened was, what I found out later was that this school is really, in some ways stuck in the 1940s, but in other ways stuck in the 1980s, because their heyday was back in the 80s, and they haven't really changed their methodology whatsoever. And so basically it's a very generic program, and some kids do okay and manage to progress, and then a lot of kids fall through the cracks and regress and get worse. And so what this school does is they choose a certain percentage of more severe cases of autism on the continuum, because other schools can't handle them and they're equipped to handle it. And then they also take a certain percentage of cherry-picked kids that they think are going to make their school look like a success and that will excel, right? So
do you have proof that they do this, or you're kind of like it's just what you noticed and saw? It's what I observed. Okay. It's hard to prove, but so like if you ask them, they won't come out and say that they do this. I don't think they would ever admit to it. The director is sort of, well, I don't want to say her name, but she's kind of a guru, right? She's a guru in that world. And what I'd like people to She's like highly respected in the field.
Yes, but a lot of it's smoke and mirrors, just like in the medical world. Anytime you have somebody who's a guru, beware, because a lot of it is manipulated to what it seems is not what it always is. And if you look at a lot of clinics and treatment centers for chronic pain, for example, the same thing. You know, there are a lot of famous places in the country where desperate people go, and some people do get better. And why is that? Mostly the placebo effect. Maybe they weren't quite as severe, and it was just enough for them to get the help they need. They throw a lot of modalities at the patients, and some of it sticks like spaghetti against the wall. You know, some of it doesn't. And then what they do is they take credit, they market look at all our successes, and their definition of success is very suspect, number one, and also how many of those, you know. So we really have to start to become discerning about discerning about these systems and these entities, right? We have to, whether it's the medical world or the academic world of autism, the ABA world, you know, that's just an example.
Right. And I asked you about, like, if you have 100% proof. I'm not saying that I question your observations. I think they're most likely correct. Yeah. But they accuse Sarno of the same thing. And I think any healthy skepticism requires that you do observe these things. And with Sarno, I actually did. Like, that was in the back of my mind. And also, not just me, but a lot of the people, a lot of his critics out there also accuse him of, like, hand cherry picking, like, the easiest cases, which when you really, it's like almost like they've never read a Sarno book, because if you really like look at his cases, they are the hardest, hopeless cases, you know?
Well, the proof is in the pudding, right? So I'm living proof. When it comes to what I noticed with the autism school that I'm mentioning, and there are others, by the way, this is just one, this is probably the most famous one, but what I started to notice was, well, firstly, my son was devolving. He became incredibly anxious. He lost all his words. He regressed. He became shut down. He got depressed. And after 10 months of that, I started to look around, and I stopped drinking the Kool-Aid, essentially, because it was all propaganda. I realized, wait, I'm in a cult at this point, because they keep propagating this idea that we're the best school ever, and you're so lucky to have your child come here. And I'm looking at most of the students, and they're wearing helmets. They can't talk. They're hitting themselves. They're self-injuring. And I'm wondering, and yes, it's true, one or two kids managed to parlay that into mainstream school, but the percentage of that is very small. And most of the kids that I saw at that school looked to me like they were regressing and devolving and deteriorating. And
what was their explanation for that, for why most of the kids were devolving and some of them?
Their excuse and their explanation was that it was a neuroanatomical thing that they had no control over, that it's something in the child's brain, and it's purely physical. So when it suits them, it's
there. Yeah. When
they do their methodology, it's all behavior. So if a child has in fact, I was in a group for special needs moms, and an autistic boy had a broken finger, and he was crying all day, and they treated him as if it was a behavior, because he couldn't speak, he couldn't communicate. She had to take him to the emergency room after school because she realized his finger was broken. But they treat everything as a behavior. But then, of course, when they don't help your child progress, or they don't help the child, their treatment is ineffective, their program is ineffective, then they blame it on the child's.
Right. So if the success is their program, if it's not a success, then it's the child. Right. It's something with the child. Yeah.
Exactly. And
that's the same thing you see with the TMS, like, just talking about parallels. It's like there's all these surgeries and stuff, and it's like, if it worked, it's the surgery. If not, then it was the XYZ explanation. Yeah. Exactly.
And it's so you see how skewed and how deceiving it is, and how self-serving it often is. And so my message is to not blindly believe in everything a quote expert tells you, because then you become really enslaved to these models, and you lose the ability to advocate for yourself or your child, and you lose your own inner guidance. You become disconnected from your own inner knowing. And as Dan Ratner always says, it's like, does this make sense? If it doesn't make sense, it doesn't make sense. And I realized with my son, I'm like, this is not making any sense. All the older children in this school are very severe, to the point of it was heartbreaking, honestly. And I thought, this is my son's future. If I keep him there, he's getting more. It's one thing to be autistic, but to also be depressed and anxious and have your spirit broken, that's a whole other story. And I wasn't going to allow that anymore. So I decided to pull him out. And it was the best thing I ever did. And my only regret is that I hadn't pulled him sooner. But because I was so vulnerable and desperate, and I thought they were experts, and I wanted to, quote, fix him, I became obsessed with recovering him and fixing him. And
then there's like all this guilt when you make a decision like that. It's like you might even feel like irresponsible. Like, I'm pulling my son out of the gold standard treatment.
Yes.
And it's a lot
of pressure. I think the overarching emotions I had during that time was helplessness, complete helplessness, and pressure. And so after I pulled him out of that school, I still was left with a tremendous amount of pressure. And he also has a lot of medical problems in addition. And there was another trauma when he was 5 years old. He almost died. He had to be airlifted. He stopped breathing for a very long time. He had to be airlifted to intensive care. He had very severe asthma, and I think he went into anaphylactic shock, but that was another trauma. So years and years of relentless stress and caretaking and advocating really took a toll on me. The one thing I will say, though, is how do I put this? At some point, I realized I had to stop viewing my child as a science project. I had to accept him for who he was. And it really improved my relationship with him a great deal. And he became a much happier kid. And, he was able to thrive. And I was able to sort of accept the autism, which was something, it took me quite a few years to fully accept his. I mean, even today, there are still days where the sadness can wash over me. But yeah, I'm kind of digressing. But
no, this is not digressing. This is very relevant.
A heavy topic, and I've never discussed this before. I've never really. This is the first time in an interview I've ever discussed this topic, and so I'm a little bit nervous, but it's weird talking about it. I did have therapy myself when I was going through my TMS recovery, and so a lot of we explored a lot of the emotions that I had been repressing. I was in such survival for so many years, and as you so astutely mentioned, the guilt. There was so much guilt, and also feelings of rage and resentment, and just the feeling of I didn't sign up for this. Just wanting my child to be, quote, normal like other kids. It was a very bitter pill. And so I had a lot of anger about his autism. And I also had a lot of, you could say that it wasn't so much rage towards my child, but he did embody the autism. So it was rage towards the autism, which unfortunately was his manifestation. So I had a lot of guilt about the rage I felt towards his behaviors. Which are of no fault of his own, of course. It's not like he can control that, but the constant tantrums and, waking up throughout the night and screaming, it really takes a toll on a person's nervous system. Most people can't even imagine. In order to really understand what it's like to have a child with autism, you have to live it. You have to eat, sleep, and breathe it every day to understand, because it really holds you hostage. It's very hard to go in public. It's very hard to have a normal life, family life, go on vacations, go to the store.
Would you say too that some of your identity was kind of your independence and identity was getting lost?
Yeah. So I certainly started to lose my own sense of self as well, because I was just in survival all the time, just putting out fires. My self-image as a mom was really in the pits because I felt like a horrible mother. I felt like I wasn't a good person, because I had these terrible feelings and impulses. I felt guilty about it because I thought, wow, I must be a really horrible person to have these thoughts and feelings. But luckily in therapy, that gave me the safety and the permission to express those awful things that I couldn't even admit to myself, right? It was so hard to talk about. And that's why I really do believe, in my case, the CRPS was a huge distraction, a defense mechanism in many ways. And, even before the CRPS, I was one of those book cure people. I had had another TMS scenario before CRPS. And I got better in a few months after reading Healing Back Pain, but then my brain upped the ante. And as Dr. Sarno always said, it just means you have more work to do. Like I just had more work to do is really what it came down to.
Right. Okay. I want to pause here. Pause here because there's a few things before we move on that I want to touch on. So one, the conflict of the feelings that are coming up, of anger, with your son, with dealing with his condition. That's awful. Those are ugly. Those are the ugly emotions.
Very,
we don't want to feel them. It's hard to come to terms with them because there's that part of us that's like, how can I feel this way? How can I feel this way, like towards him? How can I feel this way towards her? And I'm talking about you and your son, but
yes,
there's scenarios like that a lot of people go through, whether it's with their mom that they're caretaking for, their dad, their grandpa.
Yes.
Yeah.
I think, I'm sorry, I'm eating my hair. I think it's not TMS though. I think that I had to hide parts of myself from myself because we all want to kind of identify with that idealized self that we have. It wasn't
super ego.
Yes, it wasn't in alignment with. I considered myself to be a good person, a loving mother, and I was.
And you are.
But there was this shadow side that, this shadowy side that I had to hide from myself because it was much too unacceptable and like you said, ugly. And I think that I just lost my thought.
You're talking about the shadow side that was ugly that you didn't want to look at.
Right. I didn't want to look at
that
it.
Super ego conflict of like, this doesn't align with my self-image.
Right. And of course, the CRPS was the perfect defense for that,
Distraction. Yeah.
And I think one of my main themes in my life was that I had never really lived in alignment or I'd never been true to myself. And so this was sort of a wake-up call. It was sort of the symptoms were they were really me telling me about myself. It was a wake-up call. It was wanting me to pay attention, wanting me to pushing me to change. And so I had to pay attention to that. And I could no longer go on the way I had been going on.
And that's the message part, right? That's the message part. It's a distraction and a message at the same time.
Yes, it was both defending aspects of myself and that what they call the unconscious need to suffer, because there was a part of me that thought I should be punished and that I deserved to be in this hell that I found myself in because I was a bad person after all. And it was also expressing my emotional pain. I mean, the level of my symptoms and my pain correlated with the level of my emotional agony, you could say. And, my symptoms, I didn't really talk about them too much. I don't usually talk about symptoms very much, but they were off the charts. I had, it started in my right big toe and it spread. I had pain, severe stabbing and burning, and it spread throughout the foot, and then it went to the left foot. I had a mirror image, and then it spread to the knees, And then at my worst, it went full body. And I had severe neuropathic burning. I had redness, mottled colors, color changes, severe swelling. I had bone marrow edema. And at my worst, I became bedridden. And there was, I would say, like the worst, if I could characterize it, sort of like the dark night of the soul, like the dark night of the ego. It was in the summer of 2014. And I had become bedridden, and I had to use a wheelchair, and I could barely walk. I could barely get to the bathroom. And at my very worst, when it went full body, the sensation of a cotton sheet felt like an iron maiden of knives. I wasn't able to tolerate a sheet on my body. So my fear and terror and doubt was so stratospheric that my brain became very sensitized, and it perceived everything as dangerous. Even a cotton sheet became dangerous. And I tried all sorts of treatments. I'm sure Tamara mentioned some of hers, but I had ketamine infusions, which were really traumatic in and of themselves. I had PTSD just from the ketamine. They were high protocol ketamine. I also had, I flew to Europe. I flew to Italy to get bisphosphonate infusions, which is typically used for bone cancer patients. It didn't work.
For the pain for the bone cancer patients?
Well,
what is it used for them?
It was used off-label for CRPS. I'm not sure what the mechanism is, but
okay. Well, so you just tried it. You didn't even do research. You just tried it.
I was desperate. I think I would have tried it. I tried pulmonary therapy, which is like a scrambler therapy where they put like little electrodes on you. That didn't work. I did that, and then very expensive also. By the way, a lot of these things were quite costly. The ketamine. At that time,
doesn't that put you in a coma, or am I mistaken?
There used to be ketamine comas for very severe CRPS cases, but they were illegal in the States, and so you'd have to go to Germany or Mexico to do this type of coma. But I believe they've been shut down because there were some deaths. And the truth of the matter is, I was contacted by a lady who did one of those comas, and she said she came out of it worse than when she went in. And the truth is, it doesn't treat the cause, which is psychological. It simply disassociates your brain for a week.
Wow. Yeah, I actually want to comment on that because that's very interesting.
Yes.
In my mind, I've thought maybe some people need, and this is just my science mind, thinking about the future and stuff, maybe some people with TMS just need a break from life, and maybe something like an induced coma for 2 weeks might be like a rest to their brain. But that right there just proves to me that that's not true, because while they're asleep, the unconscious lives on. This is the connection I'm making. So that psychology is still playing out, whether they're asleep or awake. What do you think of that?
I believe so, because even when I was disassociated under the ketamine, and I was what they call the K-hole, it was really awful. It's like, it's very difficult to describe. It's a psychedelic type of experience, but it's not pleasant at all. And afterwards I would vomit and I would get very sick from it. And I was aware, although I was disassociated, there was a part of me that was still aware of my existence, if that makes sense.
Wow,
I didn't know what it was. It's this terrible limbo land. You don't know if you're in hell, you don't know if you're in purgatory, you don't know if you're alive. So it was a very creepy experience, and I did it about 5 times, unfortunately. It did not help whatsoever.
Is that in hopes, were they telling you maybe the 4th time will be it?
Well, they use a cocktail of anesthetic and ketamine and different drugs, hoping that it will somehow reset the brain or go to certain receptors.
My theory, right? They need a break and maybe it'll reset their brain, right?
Which it's a really good theory, actually.
Well, it sounds logical.
It does. The problem is the problem is, even if it works temporarily, the person's psychology is always going to come back online, and they're going to revert back to who they are. You can't escape yourself. And the thing is, This is such an inside job that no drug, no nerve block, no surgery, no coma, no the answer is not outside of yourself, it's within. You're never going to find that in the external world or from any gizmo or machine that they hook you up to. You're never going to find the answer there.
Well, yeah. And yeah, I mean, I guess like the whole coma thing would be like an avoidance behavior technique, which short term might be necessary,
Yes.
you know, for like people to take a break from life, so to say. Maybe you go on a vacation or whatever. But
Yeah.
at the end of the day, when you go back to your regular life,
Yeah.
it's going to come back. And I have two examples. One of them was when they ran the inpatient, which I wish that still existed, but insurance and all that. But Sarno used to run inpatient program for TMSers with Arlene Feinblatt, and she said they would get people better. They'd get better. You know, they were all happy, and you know, then they'd go back home, and like in 2 days, the pain would come back. In 2 days, because they didn't learn how to respond to life in a new way. They were still, the old unconscious programs were still running. So that's one example. And then the other example is Claire Weeks. It's just talking about anxiety here, but anxiety, TMS, CRPS, it's all the same. And she would talk about people would do avoidance techniques and, you know, they were able to kind of recover themselves. But then they would go back to like the same places that would trigger them, and they would get triggered all over again. And it was like they were back to square one when it came to being with that trigger.
Yes, because they hadn't changed their belief system around those triggers. They hadn't changed their way of being, their way of thinking. And so the first step is always knowledge, right? That's the first pillar, as Dr. Sarno said, or as he said, information is the penicillin for this disorder, right? So you have to get to the root of it. So it starts with dismantling your false beliefs. And how do we do that? We do that through knowledge and information and logic and education, right? We have to educate ourselves. And so a lot of the reappraisal and reeducation process involves getting rid of your doubts and getting rid of your false beliefs.
Absolutely.
And getting rid of all the myths.
The old programming. Yeah.
And where does the programming and conditioning come from? Where? And we know where it comes from. It comes from society. It comes from the medical industry,
doctors, yeah.
Family, our religion, our education. So we have to disabuse ourselves of a lot of the false beliefs we might have collected through conditioning.
Absolutely.
We're unlearning. Yeah, it's really a process of, like Dr. Schudner's book, Unlearn Your Pain. So we're really unlearning bad habits. And to me, TMS, I view it simply as a habit. It's just a bad habit that we have to unlearn. And I'm all about, depathologizing, demystifying this whole thing.
Yes.
And
it's one giant bad habit with a bunch of little ones inside. Yeah.
And I think I think that the label, when Dr. Schudner told me, CRPS is, because when I hit rock bottom in the abyss, I called Dr. Schudner. He was nice enough to answer my call. And he reassured me. He's like, it's still the brain though. It's still, so I only spoke to him for 2 minutes. That's all I needed to know. And once I found out it was the brain, the label lost all its power. The label lost its power. The triggers lost their power. Everything was disarmed, and it no longer intimidated me or terrorized me. And I stopped going to pain management doctors. I got out of that whole rigmarole of pain management, which is another rabbit hole, because really they're just trying to help you manage or cope with your symptoms rather than reverse it or eliminate it.
Who wants to do that? Who wants to manage that?
That's what the word. And something Sherelle said in her interview, which I completely could relate to, was she was saying how, like, this cannot be my life. Like, this is so subpar. Like, I could not accept that was going to be my life. Like, in a wheelchair, just dependent on others, dependent on, horrible medications. I thought to myself, this can't be right. This can't be it. This can't be my life. Like I wasn't going to accept that at all, you know?
Right. And that's where like the like TMS personality, like the giant ego, like, and I'm included in this, but like I speak for myself. I won't say everyone, but I just say a lot of people with TMS, including myself, we have like huge egos. We want to do well and everything. Like we refuse to accept subpar conditions, subpar jobs, subpar marriage, subpar this, subpar that. Like I want the best everything. That's just how I am. And that's where that can come, instead of hurting you, like use it for that. And then, you know, ironically, like your massive ego has also caused you pain because like you are terrible with dealing with like when you don't get your way. Right. And we become fixers and we.
What you're describing is resistance. So the trick is I had to learn how to accept and allow versus resisting, right? So it was very counterintuitive because, as you said, to your point, I was accustomed to, you know, achieving or striving or perhaps being more perfect, if you will. And I had to learn something that was very counterintuitive, which was letting go, surrendering, accepting the present moment. It started with my son's autism. I had to accept his autism. That was step one. And I think that got me on the right path in a sense, even in a spiritual sense. But yes, so if you can channel that energy and that fortitude and that grit, if you can channel that towards in the right way, towards letting go and getting out of your own way and realizing that your brain and body don't make mistakes. They're on your side. They will go back to their default setting. They will go back to normal if you stop trying to control it and try to fix it and getting frustrated and, you know, all of those things that put us in resistance, the 5 F's: focus, fear, frustration, fighting, and
fixing,
right?
I love them. I have them memorized too. Yes. I love the 5 F's.
Yeah. So apply that grit and that fortitude, and apply that desire to be well and to live in an optimal way. Apply that in the correct way. And
I like what Steve Ozanich says in his book. He says the self-destruction instinct versus the self-preservation instinct. Right. It's the same energy. It's just how is it channeled?
Right. It's two sides of the same coin. And actually, it's funny. Steve-O was one of when back in 2013, there wasn't as much out there in the mind-body world, and I was on the wiki, and you know, there were a lot of ODs there at that time, like Steve-O and various members, and those were the people who really kept me going and helped me to not lose hope, because you know, there were points in my journey where I was suicidal, to be honest, and luckily I had the support, you know, that community of the wiki, and that's of course where I later met Tamara, but that little community there was a godsend to me. And now we have a bigger community, like we have channels like yours, and we have this wonderful community where people help each other, and like Dr. Sarno said, he knew that to expedite healing, people who had recovered needed to help the people that were still going through their suffering. And so that's why I always wanted to pay it forward. He recognized how important that was.
Absolutely. Me too, Rita. And you, like, even just like our few exchanges that we've had prior to this interview have been like huge for me. Like, I can't ever like repay all of the people that have helped me. It's literally impossible. Like, because all of the people that have helped me, especially a lot of them like for free, you know, and that's why I try and like, if people accept donations, like I try and donate. And you know, if people like charge for coaching or whatever, like if you're somebody who's like has a problem with that, like there's work to be done there, because everybody is taking time out of their life to do this, you know? And not to say that they should like demand to be paid or whatever, but like, it's not a problem if someone wishes to. And, you know, even like I said, the people that help for free, like I'm always trying to pay it forward some way, you know, because they don't have to be doing it. You know, you guys can be living your life, you know, you don't have to worry about people You can be like all the other people, I've seen like with other diseases and stuff like that. Like, it's not common. Like, this is not common. What's happening in the TMS world, this is not common with other diseases. Like, many people with other diseases, if they do get better, see ya, they're gone. You're never going to hear from them again.
They want to move on with their lives. They don't want to revisit the hell they were in. They want to forget about that chapter.
Right. Absolutely. And there's nothing wrong with that. But I admire the people that do go back to the trenches and they're willing to face those triggers, because that's what they are. It's a trigger. Yeah.
Well, it's funny because as a coach, people have asked me, "Oh, do you ever feel like, triggered?" I do quotes a lot. Sorry, and I say no, because emotions aren't contagious. I can't catch somebody else's TMS because it's just their emotions, and actually, to me, it's a privilege to help others. And I never forgot. To this day, it is so vivid in my memory, like what I went through, what I experienced, the despair, the abyss, the feeling of isolation and loneliness and fear. I never forgot that, both physically and emotionally. And I never forgot those people who helped me, like, waking up at 5 a.m. and seeing Steve-O wrote me a message on the forum, right? Something like that is what that was the lifeline. I held on to that. Or people who would private message me on the wiki and say,
or Dr. Dan emailing me at midnight.
Like, really?
Dr.
Oh, that's
Dan,
great.
yes.
I get goosebumps, because I think the thing about this community is that there are some of the nicest people who have had TMS or who are struggling with it now are some of the nicest people you'll ever meet. I mean, I've never, that's the one thing I noticed about all the people I come across and my clients. They're really nice people.
Well, narcissists don't have TMS. So
no, those who
absolutely
have
not.
TMS, I guarantee you, because we're the type of people where, we are empathetic and we want to help, and we're goodists, we want to do good, and we want to pay it forward. And I think Dr. Sarno was really such a trailblazer in that sense, because he was willing to go up against all the slings and arrows of ridicule and people dismissing him, and he was willing to do that to help people. And so he's sort of a role model in that sense. He
absolutely,
he's considered a heretic in many ways, going up against the establishment. And I guess, I learned a lot from that attitude. I think, whether it's in the world of autism or whether it's in the world of chronic pain, having the courage to speak out in order to help others is the most important thing you could have, is to have that courage and to be bold enough to speak out and to put to go up to the mat and stick your neck out, in a sense, and to because a lot of times I have been sort of criticized or attacked or made fun of, whether it be on Facebook or in private emails, because unfortunately a lot of people want to defend their suffering, and they get very defensive, and they feel maybe offended by the implication that in some way they created this situation. Rather than feeling empowered, they feel insulted, because it's a very bitter, jagged pill to swallow, saying, well, I in some way caused my own.
Yeah. And also I think like the popularity of like what's it called? The theory that they're creating the pain to get like attention and stuff. What's that called again? What did Freud call that?
Secondary gain.
What is it called? Secondary gain theory. Yes.
Yeah. Well, I'm not saying that. So I think.
Well, but you even hear that when you're a little kid. Yeah. Like if you weren't somebody that faked your illnesses or whatever, like sometimes you would hear like, oh, are you faking it? You're just faking it to get out of school, or whatever.
There are cases where people do get secondary.
Absolutely.
Maybe some people enjoy wearing a T-shirt that says Fibro Warrior or CRPS Warrior.
Absolutely. I've seen.
Because they're part of a club. But I don't want to be part of that club. Like, count me out. That's not like, that's why I was very careful to avoid, and I tell people, avoid support groups and message boards for these labels, because you become victimized. And what's happening is that on the one hand, patients want to have their suffering validated by the the medical world, right? They want their suffering validated, and it feels good to be validated. But
Right.
what happens is they're actually colluding with the medical system, and they're becoming victims. You're becoming a victim, and you're becoming enslaved by your label, and you're identifying. Becomes your identity, unfortunately. And so my whole, message is to take your power back and be the expert.
Absolutely. And don't absolutely take your power back. Yes. And you don't have to trust the experts all the time. And don't even get me started. Like, I'm making a video on it soon about like the spoonie word, because I freaking hate it. I hate the spoonie word. The spoonie word, spoonie. People who are chronic illness, they call themselves spoonies, and it's like supposed to be like this cute little name for like,
Wow.
and they have this whole explanation, like when you have chronic illness, you have like X amount of spoons, and then you never know how much you're gonna have on a given day. And but the main point is like, you're not a spoonie, you're a human being. I don't care how sick you are. I don't care if you have a disability or that's real or not, it's TMS or not. I'm not gonna call you a spoonie, you're a human being. And if you have a disability, you're a human being with a disability, and that's it.
Right. Like, it's very disempowering.
Dehumanizing, yeah.
And dehumanizing, and it pathologizes you. And it's like, I don't view my son Andrew as an autistic child. Like, I view him as Andrew. I pathologized him as well. And I think that talk about the nocebo effect. When you're basically consenting to be part of a club of victimhood.
Less than, yeah.
Yeah, you're it's very defeatist, in my opinion. And I'm not sure why people want to wear that like a badge of honor. They're suffering. But I think true empowerment comes from, taking the hero's journey and using your suffering to become more resilient and stronger, and to help others, and to integrate that suffering and become a wiser, more compassionate person. But I feel that we all deserve to live in alignment with ourselves, to live an authentic life, to have joy, to have well-being. We all deserve that, And so why sell yourself short? If you join a club and you attach some moniker onto yourself, you're really selling yourself. You're shortchanging yourself, and you're living half a life, in a sense. You pay a very high price for that, and maybe it feels good to belong to something, but at what price? And is that really what you want to belong to?
I think that's what it is. I think that's like that seeking community, And I did read a study not too long ago where actually it's so crazy. So there's rats had like these they gave rats laceration wounds, which are cuts, and the ones in communities healed faster. Like, literally, the physical wound healed faster than the ones who are in isolation. So it's important. But what community do you want to be a part of? And the only forum you should be a part of is TMS Wiki Forum. And the only label, if you have TMS, the only label you should be okay with is TMS, and that's it.
Right. I mean, I think that basically the thrust of our message is that there's nothing wrong with you. You're just a human being. Welcome to the human race. And you're not broken. You're not damaged. There's actually nothing wrong with you. And so I think, there are a lot of spaces now online where you can get the community and the support for good, to get to empower yourself rather than to become a slave to the establishment. And what is their agenda? It always comes down to money or other interests. And it's really dismaying to me. I saw on one of the CRPS sites, they had like a post, and they had this imagery of like fire and icicles symbolizing like the burning and that icy.
Oh gosh, that imagery, dude. Yeah.
That really creates so much fear and doubt when you see that, just the imagery alone. So really, that if you think about visual imagery, that's propaganda right there. And I know that they don't. Well, I don't know what they're. I am suspicious, because a lot of it is money driven. A lot of it is ignorance. A lot of it's ego and hubris. But the thing is, the research has been out for like 30 years now, and the clinical care is lagging so far behind that.
Right. At this point, they're choosing to ignore the success stories like you and Tamara and others. Right.
And I think it's a travesty, because so much unnecessary suffering could be alleviated if they were to just look at the neuroscience research, if they were to just look at the success stories. You know, Tamara and I are not, we're not unicorns, we're not miracles, we're everyday people. And we're living proof that anybody can do this, that the way out is the same for everybody. It doesn't matter, how long you've suffered, how many symptoms you have, how severe they are, how widespread they are, how bizarre they are. It doesn't matter. The way out is the same. And it comes down to changing your belief system and shifting your mindset. And
absolutely. And I feel like, when you talk about like the nonprofit orgs, we're going to go there. I'm going to go there. I feel like TMS in a way like prepared me to deal with the world, like in general, because there's so many parallels to like the medical system and all the flaws in it, to just like the flaws with just like our race in general, like the human race. And in the medical world, there's a lot of nonprofits that are ran by people who don't have your best interest in mind, like PPDA, that's a nonprofit, but they have your best interest in mind. Schubiner runs that, Schechter, and a few of the people a part of it. But there are other nonprofits, not even in the medical, but like in the political realms and in many places that these people are pretending to have your best interests and they just don't.
You have to be discerning. I don't donate money to Autism Speaks, because I know that most of the money goes towards ABA, for example.
Right.
So instead, I donate to my son's school because I know where the money's going. Yes, I think Tamara created the site defeatcrps.com, and I contribute blogs there. And the reason we wanted to do this is to provide information to people with no agenda other than to help people and get the message out about Dr. Sarno's approach. I think you have to just,
be wise.
Choose carefully where you get your information.
Be very wise.
Because a lot, and I remember Sherelle saying how a lot of those groups are such fear-mongering groups. You're dealing with very anxious, lost, confused people, and all of that are forms of doubt. And doubt is poison. Doubt is what destroys confidence and hope. And so we have to stick to science, logic, proof, evidence. We have to stick to the truth.
Right. And just because someone says they don't want to help you, that doesn't matter. You trust the truth instead of a person or an expert, right? You don't trust the person, you trust the information that they're giving you, and you decide if that information is accurate or is it not accurate. So I love
Right. Yes. Or is it partial theory? Does it partially make sense, but it doesn't 100% make sense? That's a clue.
Right.
I think I had to learn the hard way with the autism journey. Don't, just because somebody's a guru or famous, you have to really be able to, see through the smoke and mirrors. There was a lot of smoke and mirrors in that world, and I fell for it. And I think in a way it made me more discerning and analytical in my chronic pain journey as far as experts. I didn't just give away my power to MDs just because they said, you're going to end up in a wheelchair. I don't have to believe that. Just because somebody says that to me doesn't mean it's true.
Right. That's for the birds. I like how you said that.
That's for the birds.
That shit is for the birds. Like straight up. Look, when I was at a point not even that long ago where putting on socks was like dreadful. And I was like, no, fuck this. Fuck that. I'm not going to be one of those people that doesn't wear socks or the right shoes that I want to wear because these shoes feel better than these ones. No, I'm going to wear what looks good because I care. And that was my ego coming in.
My vanity, in some ways, I used my vanity for good because I was like, I'm not going to wear giant Crocs the rest of my life. I've always been one of those I like like a lot of girls, I like shoes and high heels and things like that. And I wasn't going to accept that just the way Sherelle was saying, like, I'm not going to not take a shower. It's like,
Right.
there's like a limit that, and I think that's good that you don't accept certain things for yourself, that you won't, just like you said, I'm not a no sock kind of guy. So we have to draw the line in the sand, right? And I think in a way we have to hold the standard higher for ourselves that no, that is for the birds, and I'm not going to accept that. And I'm not just going to roll over and just accept a half of a life or just coping or managing or, I wasn't put on earth to suffer. And I truly believe that, I mean, if you want to get spiritual, like, I don't think God put us here just to suffer 24/7.
Oh my God. Yeah. Yeah.
Life has its stressors and its hardships and its tragedies and its challenges, but we're not supposed to be suffering 24/7. That's simply
absolutely. And if a pastor, and I have to speak on this, because if a pastor or like a religious figure ever tells you that God wants you to suffer or whatever, just to either tell them off, or if you don't, you want to be more godlike, nod your head and walk away and dismiss it, because it's not. I don't believe that.
No, I don't think any spiritual person of the cloth worth their salt would say that to somebody, because if anything, the message in all religions, if you look at worldwide religions and worldwide philosophies throughout the ages, the message has always been, we are one, and you are here for a reason, and you are worthy, and life is to be lived and enjoyed, and it has a purpose. You have a purpose, and you're important. And I would say that that's a unifying concept.
Absolutely.
And this idea of like a punishing God, that's also not true.
Absolutely.
That's a myth, that God, that the universe or God is punishing you. That makes no sense.
That comes from your psyche. Your psyche goes by that self-punishment.
Yes, that's part of ego. We get in our own way with our intellect and our thoughts and our ego. But if you look at it, if you zoom out and look at it from a higher perspective, it really doesn't make any sense. And in many ways, I think that the TMS journey is a spiritual journey. It's almost akin to a spiritual awakening. It really, I think, it helped me improve my relationship with myself and others and God in many ways. And I think if a person has a belief in something greater than themselves, it's another tool in the toolbox to give them a layer of safety and to feel safe and cared for and loved. It's very important.
Absolutely. Tamara talks about that in her book too. And I love that we touched on that, because this is a common thing when I talk to people who are like spiritual and religious, and they're like, oh, a pastor told me blah, blah, blah. I'm like, throw that shit out of your mind and never look at it, never think about it again, because it's not true. So I love that you touched on that. I was really hoping that you talked about Crocs, because I always love how you're always like, I had to wear huge Crocs. Like, I think it's so funny how you say that. And like, I actually wear Crocs like for comfort, and you probably hate me for that.
No shade against the Crocs.
But they're ugly.
My kids have Crocs, and I actually have quite a few pairs of Croc brand footwear, but they're a little bit cuter. They're more colorful. They've got some heel. They're a little jazzier than your standard Croc. But I think that it's strange. In a way, TMS co-opted my vanity in a way for fear, because I got very preoccupied with how my legs and my feet looked. And that created fear. But also, conversely, the desire to be normal and dress normally helped me do the right thing and do the work, right? So I still had to do the work, but...
So much balance in this, right? It's like you want to have your ego, but not too much. And you want to put it in the right areas, right? And you want to try and apply effort, but not too much effort. You want to relax, but like not to the point where you're just accepting the pain and you're just like, okay, I'm going to be in pain forever. So it's like, it's such a balance, right? It has been like amazing. I'm going to throw a few last observations here.
Yes.
And then, if whatever comes up.
Joseph.
You said what?
I could talk to you for hours.
Oh, thank you. Same here. That's everybody. Like, honestly, these interviews would be like hours long but I want people to like watch them, and like not overload them with everything at once. They need it slowly. But I wanna observe a few things that you mentioned. So, well, the first thing that I always want to make clear is like people always think, oh, it's one, and this is in therapy. Like my therapist made this very clear to me. A lot of people with TMS, they think it's like one traumatic event, or it's one this, or it's one that. And the reality, as my own story, and even with yours, it's not that, right?
No.
It's like a buildup of.
It's multifactorial, and it's an aggregate. It's aggregate of threat events mixed with personality traits, mixed with life day-to-day stressors. It's really an acute. Typically, when that alarm function in the brain goes off, it's a cumulative effect. When that person reaches their limit, and they go into that chronic pain scenario, it's because they've hit their limit, and everybody's limit is different.
Right.
We all have different settings, and some of us are more sensitive than others, and some of us have more trauma than it varies.
Absolutely. And it's my belief that like people say, oh, well, if this didn't happen, then I wouldn't have had TMS. It's my belief that something else would have happened and triggered it.
I believe that
something else would have came along.
I firmly believe that too, Joseph. People always say that to me. Oh, if I didn't have that unnecessary surgery, or if I didn't take that antibiotic. I mean, I've heard all sorts of crazy things, and
if this person didn't do that to me, or whatever, right?
Right. And I think it's because the brain wants to put the blame on something. Maybe it's easier to digest it, but it's a spurious correlation, and it's not that one event. Like, let's say you took aerobics class and your back went out, and then you went into a whole chronic pain thing. It wasn't the aerobics class.
Right.
Believe that. If only I hadn't gone to aerobics that day,
Right.
And so it's a misunderstanding of how this works, how the system works. And we're used to cause and effect indicators as an indicator of pain, but it's actually an aggregate. The brain catalogs and stores everything. There's all this data. And then we hit this limit, like credit card debt, I guess. And
it is. It's like a tax. It's like everything has a tax on the nervous system, right? And everybody's credit balance is different. Yeah. So some people seem to have black cards for some reason. And some people have like smaller limits, but you can expand that. You just like real credit, you can like you build up your credit, and like, so you expand your nervous system capacity, which is like a whole other topic. But just know, like, if you are sensitive, doesn't mean you have to be sensitive forever. That's just how you are right now. And
I think really quick, I just thought of this point of regret. You mentioned regretting.
Well, yeah, because it comes with that, like, oh, if I didn't do this, if I didn't do that.
Yeah, I think that's a habit of a lot of TMSers, either regretting or catastrophizing. And regretting the past is a form of self-abuse. We did the best with what we knew at that time. You can't beat yourself up for perceived past mistakes, and it's a really bad habit, and I've been guilty of that myself. And I'm sure it was part of why I developed CRPS, because I had a lot of guilt about my son. So I would say, anxiety wants to hang its hat on that one event or that one catalyst it associates with your chronic pain, but it really wasn't. It was never about that. You would have had it anyway, some other way. There was
something else would have came up. If it wasn't the class or the surgery, because life comes with challenges, unless you're like a king in a palace who never goes outside and never does anything and never takes risks and never loves anybody. And go ahead.
Yeah, unless you're a robot. And I think also the people, I would say across the board, all the people I've spoken with or interacted with in this world, or even in my coaching, these are like some of the most heroic people you'll ever meet. I mean, these are people who have gone through things that most people, it would bring them to their knees. My therapist at the time told me, if you hadn't developed TMS or CRPS, you would have probably had a nervous breakdown. Like somebody else would have had a nervous breakdown in those years of stress. It was like being on a battlefield every day. And so because it's more socially acceptable, it's a more sophisticated defense to have.
Oh gosh, yes.
Much more socially acceptable to say, my back hurts, I have a migraine, than to
Then like, I'm psychotic.
or to say I'm having a nervous breakdown,
Right.
or to say I can't get out of bed, or to say, I'm going to go do drugs, I'm going to drink. Those are not as acceptable.
Or I need to be in the mental hospital. I need to admit myself to a mental hospital. Yeah.
Because we're such highly responsible people usually, and a lot of us, have responsibilities or children to take care of or jobs, we can't afford to engage in those defenses. So it manifests in this way through chronic pain. And it's actually probably the number one most common human.
Absolutely.
Yeah.
And I thought it's like the brain is like, okay, we have a few choices. It's like a mental breakdown, an illness an episode of like mental illness, like severe depression, or my back hurts. It's like,
right. Which
one is more easily acceptable to society, and it's going to give you less judgment, right? Yeah, absolutely. The back pain. So I love that point, man. So fire. I want to put a bottom line on like, this is an inside job, right? So you were a book cure, and some people, I have my theories as to why some people are book cures, and I'll put them out at some point, and why some people are not. But I do think there's reasons. I don't believe in theories of randomness about anything. But you said you were a book cure, but then, you had inner work to do. And the recurring TMS manifestation in a more severe form was an indicator that you needed that work. And I love PRT. And I'm going to make this point, and if you have something to add on it, you can. And if you don't, you can leave it. But PRT, which has barely become popular recently, that word, pain reprocessing therapy, which is pretty much all the stuff, like the attitude towards the pain and all that. It's symptomatic treatment. Like really at the core of it, it's symptomatic treatment. And I'm going to make a bigger point on this, like in videos I'm making. It's my opinion that it is symptomatic treatment. If you don't have any inner work to do, it's not symptomatic treatment. You're actually getting at the root, because at that point, you're just dealing with neural pathways and the habit of pain. But if you do have the inner work to do, then the PRT is not gonna like completely cure you, and
no, the PRT piece is a very important piece of the puzzle, but it's for reducing fear and for neutralizing triggers. So it's great for like graded exposure and somatic tracking to disarm the triggers. And
it is half of the puzzle. You're right.
It's part of it. It depends on the person. For some people, that might be enough to give the brain a reappraisal of, and for some of my clients, like I have one client who, that's almost all we work on is the PRT piece. But I know in my case, I had to work in every area. So I had to address the emotions. I had to do the emotional work and emotional discovery, and I had to get out of repression mode. So that was one aspect. I also had to work on I guess you could call it the aspect of doubt and dismantling all the false beliefs I had that had formed a prison in my mind, these beliefs. And I had to, I'm trying to think. I also had to, in my case.
You spoke about surrendering to circumstances.
Yes. So changing my so first it started with changing my thought, like my bad thought habits. And to go deeper, I had to change my state of being. So first it started with becoming aware of my negative thought habits, choosing better thoughts until they became more automatic. That was sort of the nitty-gritty part of the work, the kind of annoying, tedious part of TMS
it's
recovery.
So tedious.
Was changing my thoughts.
PRT is easier than that. Yeah.
Yes. And then there was the mindset piece, which was maintaining a mindset of indifference towards the symptoms and, the whole outcome independence concept. Right. And also the state of being of allowing the symptoms to be there.
Right.
But my life, I had to focus more on what I wanted rather than what I didn't want, which was the symptoms. I had to focus on what do I want? What would be more in alignment with my authentic self? The other piece I had to work on, which in my case, I had to make a lot of practical, pragmatic changes in my day-to-day life, because my life, often symptoms are not about, they're not about what's wrong with your body, they're what's wrong with your life. So I really had to do some overhauls. I had to get a babysitter to help me with my son. That was a practical change.
Yeah.
I couldn't go on the way I was. I went through a divorce. I got divorced. Now, I'm not saying you have to. I'm not saying that everybody has to uproot their entire lives and move to get divorced. I'm not saying that, like, lose your job. But what I'm saying is that if something in your life, like if you're in a miserable job you hate, you might need to change your job, because
Absolutely.
you can't get better if you're constantly dealing with backstabbing coworkers or a boss that's abusive boss. So sometimes you might have to make a change. Now, if you're in, in a really terrible marriage, you might, or a relationship, you might need to end that relationship, or maybe counseling would do the trick. It really depends.
Right. But I think the point here is addressing the things in your life. Like maybe you don't have to quit your job. Maybe changing your perspective might help. Maybe you have a hatred for your job that you can work on that hatred and so it doesn't always have to be like concrete, like leave your marriage, but like you said, you can work on it. You can go to counseling.
You cannot avoid it. And it's part of what Dan would refer to as the power column.
Absolutely, yes.
If you're avoiding those things, you're not getting empowered. And
not powerful.
And when you don't have power, you have more doubt. And TMS thrives in the doubt. And so it's really important that you adopt a more powerful persona and you start to do things that are in alignment with your desires and your passions and your purpose and your meaning and things that are important to you, and having more joy and laughter and fun and taking care of yourself, more self-care. A lot of my clients put the needs of others above their own.
Right.
And that generates a lot of internal resentment when you're constantly repressing your own, whether it's desires or needs or your values for those of others, or living on the terms of others. You're really in repression mode. And so that's a setup for symptoms.
Absolutely. Yeah. Wow. We discussed a lot today. It was all value packed though. And like, if you're watching this, honestly, watch it and then watch it again and then watch it again. Not all in one day though, like you obsessive people, watch it 1 week and watch it again and take notes, because the stuff we talked about here, this is like years and years of like reading and observing and personal experience that both, I talked about here with Rita, but also Tamara as well.
Yeah.
And the goal is always to cut your guys' time shorter in any way, shape, or form. So if you want to get the most out of this interview, you do that. If you don't struggle with TMS and you watch this, I hope you just get more insight. And, because I guarantee you know somebody who has TMS. I guarantee you directly know somebody, if you're watching this, who doesn't have TMS yourself. I'm sure you know somebody who does. So I hope you guys enjoyed Rita. I do want to plug Rita in here. So you actually do the paid coaching, right?
I'm a mind-body coach, yes.
Okay, good. Okay, because I was confused. Tamara told me that. I thought it was both of you, but it's you charge for the coaching. So she does coaching. I am absolutely positive she's an amazing coach. I mean, she's overcame like one of the worst TMS manifestations. She just talked about all of the changes that she had to make. So I'm sure with you, she's like a sniper. Like, she's probably able to point out things in your subconscious and patterns that are bothering you that you probably don't even know about. So if they're interested in that, how can they get at you about that, Rita?
Oh, well, you can contact me on the Defeat CRPS site. You can contact me there, or you can email me directly. Should I give you my email?
I'll put it in the description. So send it to me, and
Okay. And you can contact me on the TMS Wiki. I'm Miffy Bunny there, Miffy Bunny. And what else did I want to say? Yes, I had to learn a lot of this the hard way through trial and error. So
Right.
I really want to accelerate my role as a coach is to accelerate the process and to get the person back to their life ASAP. And really, and I certainly don't think that one needs per se a coach. You can get better. There are many free resources and books and Curable app, and
not everybody needs coaching. Yeah, just
But-
like not everybody needs anything beyond PRT.
right,
Some
exactly.
people do.
Everybody's different, but I do think it could benefit probably the majority of people. Just to give you a kind of a booster, and I do a lot of troubleshooting, so I'm part like Virgil in Dante's Inferno in the sense that I'm a guide, I give you a roadmap, and I'm part Glinda the Good Witch. I help you see what you have already within yourself, and I'm part detective. I try to figure out what are your blind spots, and I'm part doubt demolisher. We'll do like a disputation. I'll get rid of all your doubts. So that's kind of what I do. I collaborate with the person to see what do they need and where are they in their journey. And it's, I'm really into what I do. I love what I do. I have a passion for this, and it's such a privilege for me. And I never tire of this subject because I find it endlessly fascinating. I'm always learning. And so, yeah, anybody who would like to email me or write to me, and even if you don't want coaching, I'm very happy to speak with you or point you in the right direction or give you resources. I'm always available.
Yeah, she is. She is a great resource for the community. We thank you so much for what you do.
I thank you,
And,
Joyce. Thank you for this channel.
Oh, you're welcome. You're welcome. If it helps one person, it's worth it. So,
You're going to help a lot of people. I just know it.
thank you. I'm gonna cry. The first person that comes and tells me that
I'm
the
super
panel went
excited to be here. I'm like so honored. I'm one of your first interviewees. So,
well, it was amazing. Thank you guys for watching. And yeah, I hope you guys enjoyed this interview. I hope you guys enjoyed both of these women speaking. I hope that they added value to you and you learned something useful. Rita, I mean, she went deep into the medical field, not just with TMS, but in autism. And if you see anybody who's had an experience, a negative experience with the medical field, you'll see that there are parallels. It doesn't matter what condition, what disease. The issues are the issues. They're there and they're across the board, no matter what disease or illness that's chronic and difficult to treat. So, if you guys enjoyed this, leave a comment, leave any of your opinions down there. I try to get back to all of them. And continue to follow for more. There's so much more coming to this channel. Thank you guys if you've watched all the way up to this point.